Hello, good afternoon, everybody. Myself, Dr. Prabhakar B. Hegde, in charge Department of Basic Principle. Would like to welcome today's subject expert, Dr. Kiran Khoth, sir, on the stage. Now, the program will begin shortly. I would like to request Dr. Prashant, sir, to proceed the program.
धिक्कालाद्यनवच्छिन्नानन्त चिन्मात्रमूर्तये स्वानुभूत्येकमानाय नमः शान्ताय तेजसे सर्वेभ्यः नमो नमः। अहं डॉक्टर प्रशांत गांवकरः, सहायक प्राध्यापकः, संहिता सिद्धांत विभागः, केएलई आयुर्वेद महाविद्यालयः बेळगावी। अद्य वयं संवादकार्यक्रमस्य अष्टमे कार्यक्रमे सम्मिलिताः स्मः। अद्य संवादकार्यक्रमस्य अष्टमं पुष्पं विकसति इति महत् सन्तोषः। अद्यतनकार्यक्रमस्य आरम्भः प्रार्थनया भवतु इति अस्माकम् आशा। अद्यतनकार्यक्रमस्य निर्विघ्नपरिसमाप्त्यर्थं प्रार्थनां विदधाति महिमा दवे। यथा यथा संजाना उपासते देवा संजाना उपासते समानिवाकुति समाना हृदयानिव समानमस्तु ओमनो यथावत् सुसहासति छद्वं संवदध्वं मनसि जाने मनसि जाने महिमायै धन्यवादाः। सम्प्रति अद्यतन संवादकार्यक्रमे सम्मिलितान् सर्वान् पुनः अन्तर्जालमाध्यमेन सम्मिलितान् सर्वान् स्वागतं वचोभिः स्वागतीकुर्वन्ति संहितासिद्धान्तविभागस्य प्राध्यापकाः डॉक्टर प्रभाकर हेगडे वर्याः।
Good afternoon, everybody. It gives an immense pleasure to welcome all of you for this historical event that is Samvada, scientific debate on the lines of Charakokta Vadamarga. Firstly, I would like to welcome today's the most respected Dr. Hitesh Vyas sir from Jamnagar. He is joining virtually to this event and he is going to give keynote address for this event. We from the Department of Basic Principles and from Institute wholeheartedly welcome Dr. Hitesh Vyas sir joining from Jamnagar, Department of Basic Principle wholeheartedly welcome you to this event. To you, sir.
Thank you. Thank you. Thank you, sir.
Thank you,
very
sir.
much.
Thank you so much. Similarly, we have Principal of Ravi Patil Ayurveda Medical College, Belagavi, Dr. Kiran Khotsar with us, who is going to give expertise opinion on this today's topic. We from the Department of Basic Principle as well as from Institute of KLE Ayurveda Medical College, Belagavi, welcoming today's subject expert, Dr. Kiran Khotsar to this event. Similarly, we have Dr. Suhas Kumar Shetty sir, who is president for this event. We from the Department of Basic Principle wholeheartedly welcome you, sir, to this historical event as is Samvada 8th National Level Scientific Debate. Similarly, I also take this opportunity to welcome our beloved Dean and Vice Principal, Dr. Prashant Jadar, sir, to this event. Similarly, we have, I think he has joined or shortly joined, Radha Krishna, sir, Principal, Government Ayurveda Medical College, Mysore, who is going to witness this today's 8th National Scientific Debate Samvada, and Department of Basic Principle wholeheartedly welcome Dr. Radha Krishna Sarji to this event and will take his opinion at the end of this event, as well as Dr. Bedavadi Sarji, Principal, DGM Ayurveda Medical College, Gadag, going to join us virtually at the end of this session. We from the Department of Basic Principle wholeheartedly welcome Dr. Bedavadi Sarji to this Samvada 8th National Level Debate. Similarly, we have mentors from different colleges from Mysore as well as Gadag and from our college also. We have Dr. Savita Mane Madam from Government Arithmetical College, Mysore, with Department of Basic Principle wholeheartedly welcome you, Madam. And also Dr. Subhaya Madam from DGM Ayurveda Medical College, Gadag, going to join this debate. We welcome you wholeheartedly, Madam, to this event. From the Department of Basic Principle, BMK Ayurveda Medical College, we have mentor Dr. Chaitra Madam, Department of Basic Principle, wholeheartedly welcome you to this event, who is going to mentor this team, today's group of BMK. And similarly, all the faculties and all the PG scholars who are going to participate in this national level Samvada and PG scholars who are going to be witnessed to this 8th National Samvada and UG scholars, wholeheartedly Department of Basic Principle welcome you all for today's event. Now, I would like to request our beloved principal, sir, Dr. Suhas Kumar Shetty, sir, to welcome our today's expert, Dr. Kiran Khotsar, with flower of bouquet. Basic Principle Department wholeheartedly welcome you, sir, to this event. And also, I would like, sir, mentors, sorry. We have mentors from Mysore College and DGM Gadag. I would like to request Dr. Savita Madam to come on the stage and also request our beloved principal to give a welcome. Yes, yes. I would also like to call Dr. Subhaya Madam from DGM Gathered. Dr. Chaitra Madam, you also please join. Dr. Sumaya Madam from DGM Gathered, please give a big round of applause for DGM Gathered, which is going to be participated as a wit and the audience. Dr. Chaitra Madam from BMK Aruna Medical College, Belagavi. Thanks for your support and love to our respected faculties. Similarly, I would like to thank and welcome everyone for participating this historical event, that is Samvada, which is going to be conducted by Sahita Siddhanta, basic principle of Ayurveda, in this today's 300-seater Kodkinis hall. I welcome you all wholeheartedly, and with this I conclude my welcome speech. Thank you all.
डाक्टर् प्रभाकर हेगडे महोदयाय अपि हार्दं स्वागतं। सम्प्रति अस्माभिः सह विद्यन्ते अस्माकं विद्यालयस्य प्राचार्याः डाक्टर् सुहास् कुमार् शेट्टी वर्याः। तान् अहं प्रार्थयामि संवादकार्यक्रमस्य अग्रे चालनार्थम् अनुमतिं प्रददतु इति।
आरभ्यताम् अष्टमः संवादः।
धन्यवादाः। अस्माकं सौभाग्यवशात् अद्यतनसंवादकार्यक्रमे औपचारिककथनं कथयितुम् अस्माभिः सह अन्तर्जालमाध्यमेन सन्ति वैद्य हितेश व्यासमहोदयाः। ते ITRA जामनगर इत्यत्र संहितासिद्धान्तविभागे प्रधान अध्यापकत्वेन कार्यं कुर्वाणः सन्ति। एतेषां 23 वर्षीयाणाम् अनुभवः अस्ति अध्यापने एवं अनुसन्धाने। एते अकाडेमिक् डीन् रूपेण ITRA जामनगर इत्यत्र कार्यं कुर्वाणः अन्यत्रापि बहुषु विद्यालयेषु कार्यरताः आसन्। एतेषाम् अधीने 9 PhD छात्राः अध्ययनं कृतवन्तः एवं 30 अधिक छात्राः MD थीसिस् वर्क् अपि कंप्लीट कृतवन्तः। एवमेव एते ब्रेजिल् देशे एवं जर्मनी देशेपि अतिथि उपन्यासं दत्तवन्तः इति अस्माकं सौभाग्यम्। एते अस्माभिः अद्य सम्प्राप्ताः। एते 75 अनुसन्धानपत्राणि प्रकाशितवन्तः एवं 90 अतिथि उपन्यासं प्रदत्तवन्तः देशस्य नाना विभागेषु। एवमेव एते हिंदी एवं गुजराती माध्यमे अभिनेतारः अपि सन्ति। एवमेव एते दूरदर्शने वार्तावाचकाः एवं उद्घोषकाररूपेण अपि कार्यं कृतवन्तः। अस्माकं सौभाग्यविदम् अष्टमसंवादकार्यक्रमे एते अस्माभिः सम्प्राप्ताः। डाक्टर् हितेश व्यासमहोदयं प्रार्थयामि संवादकार्यक्रमेऽस्मिन् औपचारिकं कथयन्तु इति। वैद्य हितेश व्यास महोदयः।
Thank you. मैं audible? मैं audible? मेरी आवाज आ रही है?
Yes, yes, please.
Okay, okay. Thank you very much, respected principal sir, respected Prabhakar sir, all the respected teaching faculties, PGT, PGPAT scholars, and all the participants. Before I start to give some keynotes or some points, I want to show my gratitudes towards the organizers. They remember me for this beautiful contest, which is only one in the entire country, I think. Such kind of the event, I don't have idea that any other college is organizing such kind of event. And I'm ashamed also that I cannot speak in the Sanskrit like you people. I should speak Sanskrit, but I'm not able to speak Sanskrit fluently. So it's not like that. Hello. Video on nahi hai? Okay. I think some technical problem is there. So I'm not getting my video.
It's okay, sir. Continue.
Huh. So I'm trying to start my video, but I'm with you. So what I'm talking about that it's my fortunate to be with you today, and I wish a very successful event, and I wish best of luck to all the participants. Actually, such kind of this events are very much important for the our field or the field when our students either they want to go to the field as a teacher or as a practitioner or in industry anywhere. It is very important to get the samvad or the dialogue or the communication skill in today's parlance, if we say, to develop the this communication skill is very much important thing, and this kind of functions are very much important, or this kind of events are very much important for this thing. So I think this will help all the scholars to develop their communication skills, and it will be useful for their life, because to present our thoughts within a few words or to counteract the argues with a scientific manner, it's a very necessary skill in our field. So this kind of the program will very much helpful for all these participants, whether they win or whether they no win. That is another matter. Winning or not winning, losing is the another matter, and I don't give much strength to that particular thing. But participating in Samvad and developing the communication skill is the thing which is very much essential. So I congratulate the department, the institute for organizing such a useful and beautiful contest. Secondly, the subject whatever is selected for this particular Samvad 8 or the 8th part of this event, that is Dashavidha pariksha, is a very important subject. I think all the participants will speak on this, so I will not speak on much of this. But pariksha for the doctor, pariksha for the vaidya, or the pariksha for a researcher is a very important thing. Chakrapani says, parikshate vyavasthapyate vastu swarupam anaya iti parikshaha. We can decide the form, or we can know the real things or the real knowledge only with the pariksha. And there are many kind of the parikshas. Atur pariksha is there, Aushad pariksha is there, Rog pariksha is there, Acharya pariksha is there, Shishya pariksha is there, Granth pariksha or Shastra pariksha is there. And much kind of the parikshas are there, but among all those pariksha, the most useful or the most popular pariksha in the field of Ayurveda is the Dashavidha pariksha, which is mentioned by the Charak, or I can say it is the original contribution of Charak Samhita in the field of patient care. So this is one of the most important or the core area which has been selected for this particular Samvad. So I congratulate for that also. I don't want to speak on the Dashmudha Pariksha or on the Charak Samhita much more, because the participants are going to speak on these things. So I want to listen all those participants as much as possible, because I don't know what are my next meeting schedule. So, but as much as possible, I want to listen all the participants with this particular subject. So once again, I thank the organizers. I thank the Prabhakar ji, principal sir, and best of luck to all the participants. Thank you. Thank you all.
अस्माकं संवादकार्यक्रमस्य मूलम् उद्देश्यम् इदमेव। तदुक्त्वा अस्मान् प्रोत्साहितवत्यः वैद्य हितेश व्यास महोदयेभ्यः अस्माकं विभागपक्षतः अस्माकं विद्यालयपक्षतः अपि धन्यवादाः। सम्प्रति अत्र संवादकार्यक्रमे स्थापना प्रतिष्ठापना वितण्डवादिसदस्याः वेदिकायाम् उपस्थिताः सन्ति। तेषां परिचयं वयं प्राप्नुमः। तत्रादौ स्थापना सदस्याः KLE महाविद्यालयस्य छात्राः।
Good afternoon. Myself, Dr. Naveen from second year PG scholar from Dashavidha department. I'm from, we are from Stapana group.
Good afternoon. I am Dr. Meghna, second year PG scholar, Department of Dravyaguna.
Good afternoon. I am Dr. Akanksha, second year PG scholar from Department of Swasthaguru. Good afternoon to all and all. I am Dr. Vagni from the Department of Panchakarma, second year PG.
All, myself, Dr. Raghavendra Nayak from the Department of Shalakya Tantra, KLEBM Ayurveda.
स्थापना सदस्येभ्यः हार्दं स्वागतं। सम्प्रति सर्वकारीय आयुर्वेद महाविद्यालय मैसूरुतः प्रतिष्ठापना सदस्याः सन्ति।
मम नाम वैद्य पूजा बीजी, कायचिकित्सा विभागस्य छात्रा अस्मि, सर्कारी आयुर्वेद महाविद्यालय मैसूरु। शुभ मध्याह्न। मम नाम वैद्य HS हर्षिता, कायचिकित्सा विभागस्य छात्रा, सर्कारी आयुर्वेद महाविद्यालय मैसूरु।
शुभ मध्याह्न। मम नाम वैद्या निवेदिता, संहिता सिद्धान्त विभागस्य छात्रा अस्मि, सर्कारी आयुर्वेद महाविद्यालय मैसूरु। सर्वेभ्यः शुभ मध्याह्न। मम नाम वैद्य अनुषया स्रायकर, स्वस्थवृत्त एवं योग विभागस्य छात्रा अस्मि, सर्कारी आयुर्वेद महाविद्यालय मैसूरु।
सर्वेभ्यां शुभ मध्याह्न। मम नाम वैद्य श्वेता पाटिल, पंचकर्म विभागस्य छात्रा अस्मिन्, सर्वकारीय महाविद्यालय मैसूरु।
प्रतिष्ठापना सदस्येभ्यः स्वागतं। सम्प्रति JSVVS श्री DGM आयुर्वेद महाविद्यालय गदगतः वितण्डवादी समूह सदस्याः सन्ति।
Good afternoon, everyone. Myself, Dr. Meghna, second year PG scholar from the Department of Panchakarma, DGMC Gadag.
Good afternoon, everyone. Myself, Dr. Sapna Lopez, second year PG scholar from the Department of Kayachikitsa, DGM Ayurvedic Medical College, Gadag. Good afternoon, everyone. Myself, Dr. Komal from Department of Kayachikitsa, DGM Ayurvedic College, Gadag. Good afternoon, everyone. Myself, Dr. Sridevi Vedel, second year PG scholar from the Department of Panchakarma, DGM Ayurveda Medical College.
Good afternoon, everyone. I am Dr. Vedavati, final year PG scholar from the Department of Kayachikitsa, DGM Gadag.
वितण्डवाद सदस्येभ्यः अपि संवादकार्यक्रमे हार्दं स्वागतम्। अद्यतन संवादकार्यक्रमे विषयविशेषज्ञाः सन्ति डॉक्टर किरण खोत् महोदयाः, प्राचार्याः डॉक्टर रवि पाटिल आयुर्वेद महाविद्यालयः बेळगावी। तान् सभां प्रति परिचययितुम् अस्माकं विभागस्य प्राध्यापकान् डॉक्टर प्रवीण एन् भिरडि वर्यान् प्रार्थयामि।
Good afternoon to one and all, respected dignitaries on the dais and off the dais. It's an immense pleasure to me to introduce today's expert, Dr. Kiran M. Koth, sir. It's a happy for us also. Sir has completed his UG in our KLE BMK Ayurveda Medical College, Belagavi. Sir is alumni of our college. And sir has done his MD in Kayachikitsa department from Ayurveda Mahavidyalaya, Hubli. And sir has completed his MD of PhD in the Government Ayurveda Medical College, Rewa, Madhya Pradesh. And sir has clinical experience in the super specialty hospital in Mumbai. And sir worked in various Ayurveda medical colleges. And sir has presented several papers in the national and international journals. So sir is not an academician also. Sir is a clinician and running in a clinic in Belagavi Mundi. And presently, sir is working as a principal in Dr. Ravi Patil Ayurveda Medical College, Belagavi, and co-founder for Paitiv's Ayurvedic Pharmacy in the year of 2021. And sir has done so many camps also, Zito organization in remote villages and the flood areas. It's a happy for us you are being with us, sir. So wholeheartedly, I welcome you. With this brief introduction, I welcome you, sir. Thank you.
धन्यवादाः। अद्यतन संवादकार्यक्रमस्य विषयविशेषज्ञान् डॉक्टर किरण खोत् महोदयान् प्रार्थयामि अद्यतनसंवादकार्यक्रमस्य विषयस्य उद्घोषणं कुर्वन्तु इति।
So to everyone, be a part of this Samvada 8.0. And here I announce the session is open for the debate, that is Dashavidha pariksha vishesha parikshitavya. Only Dashavidha pariksha is to be done, is to be examined in patients. Once again, I announce the session is open for debate. Thank you.
विषयोद्घोषणं कृतवद्भ्यः विषयविशेषज्ञेभ्यः धन्यवादाः। सम्प्रति वादसंवादकार्यक्रमः आरभ्यते। तदर्थं संवादनियन्त्रकान् डाक्टर् प्रभाकर हेगडे वर्यान् प्रार्थयामि संवादस्य अग्रे चालनार्थम्।
Dhanyawada, Prashant Gaonkar Mahodaya. Now we are going to start the scientific debate on the lines of Charakoktavada Varga, which is mentioned in 8th chapter of Vimanasthana Charaka Samhita. For this first round, which is mentioned as Prathama Vartula, I would like to request the Sthapna members to debate for the first round, that is Prathama Vartula, with Panchavaya Vyakhyas, that is Pratijna Hetu Dharana and Upanaya. I would like to call the Sthapna members from Keli Ayurveda Mahavidyalaya to put forth their statement that is on the topic which is announced by today's expert, Dr. Kiran Khodji sir. That is Dasha eva pariksha vishesha parikshitavya. Only Dashavidha pariksha vishesha is to be examined in patient, and these are most important, not others. He is going to be defended by Sthapana, and the against statement is going to be put forth by Pratisthapana members, and wrangling will be done by Vitandavadi, that is DJ Marada Medical College, Kadar. I would like to request the Sthapana members to proceed their statement for the first round, Prathama Vartula, through PPTs. Over to Sthapana members.
Thank you, sir. Pratikya, Dasha eva pariksha vishesha parikshitavya.
Only Dashavidha pariksha is to be examined in the patient.
Hetu, kramagatvatvat, upadhara and upadeshtartha.
Kramagatatvat is sequential order, Upadharana is to remember, and Upadeshartha is to teach.
Dristanta, rasat rakta, tato mansha, manshat meto, tato astica, asno maja tatha shukram, shukrat garva prashadaja. Yadi cha ekam eva kinchit dravyam, amasayada tatha gunayuktam, tat sarva karmanam, karane samartham syat, kah tato anyet ichet upadharayitum upadestumba shishyabhe iti.
As in Charaka Chikitsa, Grahani Adhyaya, it is said that Rasa forms into Shukra and Shukra forms into Garbha in a sequential manner. In the same way, it explains the importance of a particular order. And the next shloka depicts, like in Charaka Sutra, 4th chapter, it is said that one drug is capable of acting in various disorders. It is wise enough to teach a drug rather than teaching many or understanding many drugs.
Upanaya anusandhane yatha kramasah marga anusaryante तथा रोगी परीक्षायां दशविध परीक्षा विशेषः एव अनुसार्यन्ते.
The idea of how a research process has a stepwise approach to establishing an idea or the result. Likewise, there is a stepwise approach in Dashavidha Pariksha Bhava to establish a clear diagnosis. Even though there are lots of dravyas set for Jivaniya action, but Acharya Charaka has pointed out that milk, that is Kshira, is Jivaniyam. Likewise, the Dashavidha Pariksha is considered to be the essence of all the Parikshas.
निगमन अथ दश एव परीक्षा विशेषः परीक्षितव्यः.
From the above statements, it is established that the Dashavidha Pariksha stands above all the different standards of Pariksha, as it comprises of those, and it makes a systematic way to understand the patient-disease relationship for the treatment.
Big round of applause for the Stapna members for putting forth their statement in the Prathama Vartula by taking the example of the Krama, and they are giving or they are bringing the example of a research protocol, how the protocol to be followed step by step. Similarly, there is a protocol to examine the patient in Ayurveda, and the most perfect method to assess the and examine the patient is through Dashavidha pariksha. And not only this, but also the Aptopadesha is also considered here as the supportive statement for the Prathama Vartula by Sthapna members. Now, we are going to take the opinion of the Pradishtapna members, how Dashavidha pariksha, vishesha na parikshitavya, how they are not important, and what is important than Dashavidha pariksha Sanhita of Charaka. Over to Pradishtapna members for Prathama Vartula. Captain, you can proceed.
Thank you, sir. संवादे वयं प्रतिष्ठापनपक्षतः वादं करिष्यामि. Introduction. Pariksha is derived from pariksha, which means to observe in all the directions, to examine. Pratisthapana. Dasha eva pariksha vishesha parikshitavya paryaptam na bhavati. Only Dashavidha pariksha are not sufficient to be examined in patient. To prove our pratisthapana in the present samvada, we will be substantiating it with 5 different sadhya. Pratigna 1. Dashavidha pariksha bhavaha swatantra bhava na bhavanti. Dashavidha pariksha bhava are not an independent pariksha bhava. Hetu. Dashavidha pariksha bhavaha chaturvidha pramana nidana panchaka pariksha chakriya kalascha ashritaha. Dashavidha pariksha bhavas are dependent on chaturvidha pramana nidana panchaka pariksha and kriya kala. Drishtanta. Yatha netre drishyate jagat tata pramanaihi pariksha. First drishtanta, agnim jarana shaktya pariksheta balam vyayama shaktya. Digestifier should be inferred by the power of digestion, and body strength should be inferred by exercising capacity of the person. Second drishtanta, kriya kalam na hapayet. Treatment should be administered at the correct stage of the disease to ensure efficacy and prevent complications. Third drishtanta, Pratamam rogaha nidana panchakena parikshyate. Initially, disease has to be examined by nidana panchaka in the patient. Gudalinga vyadhim upashaya anupashayabhyam. Diseases with hidden signs can be inferred only from upashaya and anupashaya. Upanaya. Tad vividham khalu sarvam sacha sacha. Tasya chaturvidha pariksha aptopadesha pratyaksha anumana yuktischeti. Rogam Nidana Pragrupa Lakshana Upashayaptibhi. The diseases are to be diagnosed with the help of Nidana, Pururupa, Rupa, Upashaya, Samprapti, and Samprapti Ghatakas. Kriyakalam Vina Rogasya Avastham Gnatum Na Shakyate. Without assessing the Kriyakala, we cannot know the stage and progression of the Roga. Hence, our Nigamana for the first Pratigna is Ataha Roga Pariksha, Rogi Parikshanasya Anivaryam Angam Bhavati. Evam tu pramana nidana panchaka evam kriya kalasya gnanam vina na sadhyate. Therefore, examination of disease is essential part of patient examination, and this can be done only with the knowledge of pramana, nidana panchaka, and kriya kala.
Our second pratigna is Karanam Ature Pariksha Vishesha Bhavo Nasti. Karana, physician is not a Pariksha Vishesha Bhava in the Atura. Hetu, Vishak Rogishu Karanam na Bhavati. Physician is not a factor in patient. Drishtanta, Yata Shikshakaha Chatrasya Parikshayam Vishaya na Bhavati. Just as a teacher does not become the subject in the student's examination. Upanaya, Yata Shikshakaha Chatrasya Parikshayam Vishaya na Bhavati. Tathaiva Vaidyaha Rogi cha Swatantravantaha Bhavanti. Just as a teacher does not become the subject in the student's examination, similarly, the physician and the patient are independent entities. Physician never become pariksha bhava during the examination of the patient. Nigamana, भिषक् स्वयं रोगिणः परीक्षायां कारकः न भवति. The physician himself cannot become a factor in the patient's examination.
Our third pratigna is kevalam dashavidha pariksha vidayaः paryaptam na santi roginam parikshitum. Relying solely on the Dashavidha pariksha may not be necessary for examining patients. Hetu is pratitantra siddhanta, drishtanta, samanatantra pratyaya. According to samanatantra pratyaya, desha, veshaja, desha, kala, bala, sharira, ahara, satmya, sattva prakriti, vayasam, avastantarani, vikharashcha, which is stated in the virechana karma. Next. According to Paratantra Pratyaya, according to Yoga Ratnakara, Nadi, Mutra, Mala, Jivha, Shabda, Sparsha, Akriti, Druk has to be examined. And according to Shishita in Raturopa Kramaniya Adhyaya, he has stated that Ayu, Vyadi, Rutu, Agni, Vaya, Deha, Vala, Sattva, Satmya, Prakriti, Veshaja, Desha has to be examined. उपनयन इस् दृष्टान्त सहायेन आवश्यकतायाम् आधारितं विविधाः परीक्षाः विविधान् दृष्टान्तान् अनुसारिताः उक्ताः. With the help of the illustration, it is explained that various examinations have to be conducted to obtain the pratipatti gnana of roga and rogi. Hence, Vaidya should not limit himself to only one type of pariksha. Instead, for the welfare of the rogi, one should utilize the parikshas mentioned in other samhitas or other contexts as well. Nigamana, Vishtataya rogi parikshanam vishaye dashavidaha pariksha nityam avakashyam na bhavati. Therefore, in specific to the patient examination, all among the Dashavidha parikshas may not be necessary always for examination in patient.
Presenting our fourth pratigna, आपत्कालिके परिस्थितिषु दशविधा परीक्षा न प्रधान परीक्षा भवति. In emergency situations, Dashavidha pariksha cannot be considered as a primary examination. Hetu, vibhinna apat samayeshu roginam parikshaha vibhinna bhavati. Examination of patient differs in different emergency condition. Coming to the drishtanta, buddhya jale patitam pindam pankaje majjati samvedya patate. With intelligence, as a person grasps the object falling in water before it reaches the bottom. Upanaya, yatha jale patitam vastum upagranati shigram तथा समय चिंतयन् चिकित्सार्थं वैद्यः आपत्कालिके परिस्थितौ केवलं विशिष्ट परीक्षान् आशु प्रारंभयेत्. एवं दशविधा परीक्षा अधिककालम् आपद्यते. Just as person quickly grasps an object falling into water before it sinks, similarly, recognizing the importance of time and life, the physician should begin treatment by conducting only very specific examination in emergency situations, as performing all the Dashavidha pariksha bhavas consumes more time. Nigamana, tasmat apat samaye roginah avasthayam parikshanam nirbharati. Yatha roginah jivana rakshayam pradhanamasti. Hence, in an emergency, the examination depends on the condition of the patient, as saving the life of the patient becomes the top priority.
Our last pratigna is Kevalam Dashavidha pariksha Vaishvikaranaaya paryaptam na asti pariksha karye adunika tantragnanam avashyakam. Only Dashavidha pariksha is not sufficient for globalization. Advanced scientific technology is needed for examination. Hetu यतः विभिन्न रोगाणां परीक्षायाः विविधः विधयः आधुनिकतन्त्रज्ञानं च आवश्यकम्. Because different methods and advanced scientific technology are needed to examine various diseases. Drishtantavan and its upanaya. Kupastha mandukaha evam yata kupastha tata vishale samudre vishesham na janati. Upanaya. Evam rogi parikshayam anyani vijnanani yata yogyam samyak janiyani. Just as a frog in a well knows only about the well and is unaware of the vast ocean, similarly, other sciences should be appropriately integrated for the complete knowledge and examination of the patient. Drishtanta 2 and its upanaya. यथा परिष्कृतदूरदर्शनयन्त्रं सूक्ष्मवस्तूनि स्पष्टतया दर्शयति तथैव आधुनिक उपकरण एवं अन्वेषण रोगनिश्चयम् अधिकविश्वसनीयं कुर्वन्ति. Just as an advanced telescope shows fine details clearly, similarly, modern equipment and research makes diagnosis more reliable. निगमन एवं आयुर्वेदस्य मूलसिद्धान्तान् अपरिवर्तितान् अपि रोगीपरीक्षा तु अन्यविज्ञानसारं युक्तियुक्तं सम्यक् जानीया भवेत्. Thus, without altering the fundamental principles of Ayurveda, the examination of the patient should be appropriately blended with the essence of other sciences. Thank you.
Big round of applause for GAMC Mysore for bringing 5 different udharanas and upanayas and debating for their statement that is against Sthapna. And they are telling that Dashavidha parikshas are not that much important, where the other parikshas like Chaturvija parikshas, which are mentioned in 11th chapter of Charaka Samhita Sutra Sthana. Not only this, but also Sanchaya, Prakopa, Prasaradi, Shad Kriyakalas, those examination is important. Not only this, but also Nidana, Pura, Rupa, Rupa, Upashaya, Sampraptivihi, those Roga and Rogi Pariksha, how they are important. You are giving importance to only one Pariksha, that is Atura there, by Dashavidha Pariksha, Karana, etc. And not only for Guda, Dinga, Pariksha, Upashaya, Anupashaya should be done properly. And not only this, but also 2 important examination Charaka emphasize in 11th chapter of Sutra Sthana, that is Sat and Asat Pariksha to be done through Chaturvida Pariksha. And physician should not limit himself to only the limited examination, as there are Ati Chikitsa also, how the Dashavidha Parikshas are going to be helpful for the physician. And also the research, whatever inventions are there these days available, those need to be taken help for the examination. And we should not be like Kupats the Manduka, as taking only the help of Dashavidha Pariksha mentioned in Charaka. And Paratantra Avalokana should also be done like Sharangadara Samhita, as well as Bhaishya Ratnavali. Different scholars have mentioned different examinations they are mentioning and substantiating in first round itself. If this is the scenario and defending their point in the first round itself, what would be the second round, that is substantiating round? So all be careful and try to give your point at the best. And I would like to take the opportunity for Vitandavadins to put forth their statement, initial remarks on the today's debaters against Sthapana and Pratishthapana. Do you want to give any statement on the today's debate of the statement on Sthapana and Pratishthapana which they have taken? Do you want to give any remark, first remark on the statement? Yeah, you have enough time in second round, after second round, but you can give your initial remark.
In the second round itself.
Okay, so with this, we are going to finish the first round, that is Prathama Vartula, which is stated by Sthapana members and Pratishthapana as well as Vitandavadins. They want to take their opportunity in the second round after finishing the second round. Now, the second special round, I think compared to Pratishthapana, Sthapana members have taken little less time to explain their views on the first statement which they have opted, that is Dashavidha pariksha, vishesha parikshitavya. Now it is time to explain and substantiate and give the enough substantiation and justification for the topic. I would like to call the Sthapana members. How can you justify how only Dashavidha pariksha, vishesha are to be examined in patient? Why others are not important? Over to Sthapana members.
So as we know, the Ayurveda science is
Please be loudly while you are speaking.
So Ayurveda science, it is dealing with mainly the dhatu satmyata. So we know कि धातु सात्म्य क्रियाश्चोक्ता तंत्रस्य अस्य प्रयोजनम. So whatever we do in the treatment aspect, the main aim is dhatu satmyata we have to achieve. And for that dhatu satmyata, we need to go for the Dashavidha pariksha, because from top to bottom, the Dashavidha pariksha, whatever they have mentioned, so that includes the each and every examination part, what should be conducted in a physician and the rogi and the other aspects also, not only related to a patient's, it is related, it relates to all the things what should be done during the treatment and during the diagnosis and during the plan of a care what we are going to do. And one more thing is, so we know ki rogam ado parikshaye tato anantaram aushadam. So whenever we are going to prescribe the aushada in the patients, so we need to know the roga pariksha first. So from where the initiation of the disease is occurred and through what way it is carrying and how it is developed. So these all things are should be seen in case of a roga. And one more thing is, if it is vikara, then obviously there will be, as we know, the definition of vikara is vikaro dhatu vaishamyam. If otherwise it will be, if it is a dhatu samyata, it is a rogata. So we have to see which dhatu is vishama there. So which dhatu level we have to act and what drugs should be prescribed. That is a main thing. So this is a starting point, and we have the Dashavidha pariksha from starting with a karana and karana. So there are 10 Dashavidha pariksha. So from individually we have to go for first thing is karana. So if we know the karana is main is bishak. So whenever we go for the examination part, so bishak what qualities he should possess. So whenever we see the physician, so we have in first chapter of Ashtanga Hridaya, ki Bishak Dravyanupasthat Rogi Padachatushyam, these all things you know. So after that, Bishak should have his qualities like Parevadatatvam and Shauryam. And one more thing is, thing we have ki Shaucham, so Daksham. So these qualities he should have. And depending upon these qualities, the treatment is going to be in a successive manner. And one more thing is, we have the drugs here. So whenever we go for the treatment aspect, we are giving the drugs, and or else we are giving the any chikitsa aspect. So we may take the some of the Daiva Vyapashraya chikitsa also, Yukti Vyapashraya chikitsa also. So these all things should be seen whenever we have a drugs. So it is grown in a proper way or not, or the proper pradesha or not. So whenever we are choosing the drugs from the different habitats, so we have to go for, so where it is indicated, so there only we have to take the drugs. One more thing is regarding physician. So whenever we go for the surgical aspects and the clinical aspects, so whoever is going to become a bishop, so they all can't be practiced in a same way. So each and every bishop is having his different specialities. So whenever you go for the surgery, so some minute surgeries, in case of some of the corneal surgeries, if we going to see, so where our hand-eye coordination plays a very important role. So in that aspect, the bishop should be examined. So we need the Dashavidha pariksha where in Karana, so bishop qualities, whatever is having, so that examines the qualities of the bishop. And Karana, I have explained it like it is Punar Yojana of the whatever drugs or the whatever processing things are there. Whenever we go for the Mardana Samskara, so which drugs are going to be used in the Mardana Samskara. So these all things play a role in case of examination. And this Dashavidha Pariksha has inclusion of everything, whatever we are going to see and we are going to examine. So why it has been told it is a etat Dashavidha Pariksham Agre. So these are the main part what we are going to examine. So instead of examining the other part, so you do this, so you will be achieved more. So this is our works.
Further, moving forward for the Dashavidha Parikshas, we would like to explain about Karya Yoni. Acharya explains Karya Yoni are Karya Yonistu sa ya Vikriyamana Karmatvam Apadyate. Karya Yoni, where we can include like Samavai Karana. The literary meaning is the changing process or the respective methodology in which through which the Karya should be achieved. That we are understanding as Karya Yoni. Then Vikriyamana we are understanding as Rupantara Apadyamana. Rupantara Apadyamana, here it goes like how, Rupantara meaning when we are preparing or procuring any drug, we have to see from where we are procuring or how we are preparing, meaning which form we are going to give it, like churna form, kolka form, or any other form, or making it palliative also. Like here also we can enter into the field of globalization, how we are explaining like how to make our product more acceptable for the patient as well as the Vishak and the Upastata. Then moving forward, I would like to elaborate like Ati Pravriti, Sangha, Vimarga Gamana. This could be the probable reason of the Dhatu Vaishamya, because Karya Yoni is the Dhatu Vaishamya and Karya comes under like we have to bring the Dhatu Samyata. And moving forward towards Karya, Karya means kartavyasya buddhi sthirikritya karya tu tatyasa abhinivrittvatvat abhisandhaya karta pravartate. The act which the karta has to do to achieve the dhatu vaishamya to dhatu samanata means the karya only here. Here, further moving forward, karya dhatu samya tasya lakshanam only is vikara upasamya. Then further moving forward, like the Acharya explains very beautifully how to do the pariksha of dhatu samyata, how it is like pariksha tasya rup upasamanam swaravarna yoga sarira upachaya bala bruddhi abhyavaharya avilapa ruchir ahara kale abhyavavrutasya cha aharasya kale सम्यक जरणम निद्रा लावे जथा कालम विकारिणाम च स्वप्नम आदर्शनम सुखेन च प्रतिबोधनम वातमुत्र पुरुष रेतसां मुक्तिः सर्वकार्ये मनोबुद्धि इंद्रियाणां च उपसम्यति इति. Meaning the karya here is not only the dhatu vaishyamya, including the saririka and manasika sukha also. Then this is for this I like to quote that it is nothing but the chikisha only, because in the definition of chikisha itself it quotes as yavi kriyavi jayante sarire dhatava samaha sa chikisha nigadyate karma tat veshaja smrutam. And like for explaining the karya yoni also, we can include like all the types of pariksha, including starting from the Chaturveda pariksha to Dashavidha pariksha, is nothing but it is ordinary one part of Karya Yoni itself. And in Karya Yoni itself, we have to decide the Samprakti Ghataka and the Nidana Panchaka of the disease.
Moving next is Karyaphala. Karyaphala punah tat yat prayojanah karya abhinivritti ishyate, which means it is that with the object of which the action is performed. Karyaphala sukha prapti tasya lakshanam mano buddhi indriya sarira tusti, which means result of the act is attainment of happiness. It is known by the satisfaction of mind, intellect, sense organ and body. So it is said that धातु सम्य क्रिया प्रोक्ता तंत्रस्य प्रयोजनम and समदोष समाग्निश्च समधातु मल क्रिया प्रसन्न आत्मा इंद्रियमना स्वस्थ इत्यभि धीयते. If the right karya will be done, then the right action, then the right result will be followed. So I would also like to quote that prayojanasya asya swasthasya swastha rakshanam and aturasya vikara prasamanam. Coming next is anubandha. Anubandha khalu sa ज कर्तारम अवश्यम अनुवदनाति कार्यम उत्तरकालयम कार्य निमित्त शुभ वा अपि अशुभ भाव, which essentially enjoys the doer as after effect good or bad of the action. Anubandhastu khalu ayu tasya lakshanam pranay sah sanyoga. Life is which is characterized by the union of vital breath. In Anubandha, I would like to come like Tatkalik Phala and Uttarkalik Phala. Like if a potter will make the pot then it will sell the pot, then the money he will earn that will come under Tatkalik Phala, and by the money he will help to bring his family, that is comes under Uttarkalik Phala. And after Anubandha, Ayu also comes under Anubandha. So it is quote like Dharma Artha Kama Mokshanam Arogyam Mulamuttamam Roga Tatshap Upatara Shresha Jivitasya. After attaining of good health only, one man can involve in Dharma, Artha, Kama and Moksha. Thank you.
moving further to Desha. Desha refers to the land as per Rajanigantu in Anupadi Varga as Anupa Jangalan Sadhana. It also refers the habitat or the place where all living organisms flourish. As per Dharma Sastra, it relates to a district. As per Yoga Sastra, it refers to one's own region, meaning the whole body is considered as a region, according to Sarvatjnanotta. As per Vyakarana, Ucharanasthana, that means place of origin, and Paribhasha Desha Uddesha means place of influential establishment of Paribhasha. So Desha can be represented in two distinct subjects, that is, one is Deha Desha and one is Bhumi Desha. So we come to Deha Desha. Deha Desha represents the Sharira. Here the examination of the Deha Desha is done with Dashavidha Akruti Pariksha, that is Prakriti, which establishes the constitution of the body, Vikruti, imbalance occurring in this constitution, Sara, essence of the tissue, Sammanana, compactness of the body and body parts, Pramanana, measurement of the body, Satya, habits and compatibility of the body, Sattva, physical strength, Ahara, Shakti. It says about the digestion, metabolism, catabolism of the Dhatu level, and Vyayama Shakti says about the exercise and stress tolerance in the person, and Vaya is the age of the body. So if we move on to Bhumi Desha, the Bhumi Desha represents the various deshas such as I said in the classic, that is Anupa Sadhanan Jangal. It also represents the drug that is acquired from the specific desha land, their quality and their quantity. For example, Agastya grows more in Vanga Desha. The Paryaya comes as Vange. Then in Draksha, it is said as Uttarapata. In Lata Kasuri is found in Dakshin Desha. So they have given specific Paryaya for specific drugs. Then if you go for more, the specific plants and the animals that habitat the particular place is given. Like example, in Jangala Desha, Khadira, Khadara are seen in this region. And in Bhumi Desha also suggests that the types of disease that can be seen in the particular example. According to Acharya Bela, Parvata, there is most predominant Abhisandhya Roga is most predominant. Then in Balika region, Balak Shaka is predominant disease. In eastern region, Tafaja Vyadi is predominant. In southern part, Kushtaroga is predominant. And the people who are living in the outskirts of Kamboja Desha, Harshas is predominant. In medicine preparation, the Disha is explained for the construction of Rasahala. This is set to specify the Disha to make the quality of the drugs to be prepared or created. If the patient is taken from the region, they can be considered as a Shukasadhya Vyadi, because if a specific person comes from a specific land, we'll come to know that this disease is specific. Say example, I'll go through Pela Samhita. From eastern region, there are Kapha Vyadi. Means if the patient who is coming from eastern region has Kapha disorders, so we can treat that as a Sukhasadhya Vyadi. But if the patient again it comes from other disease with Kapha Vyadi, we should take it as a Kastaja Vyadi. If we move on to next, it's Kala. Susruta Samhita says that Sa Shukshmanam Api Kalam Na Liyate Iti Kalam. Some Kalayati Kalayati Va Bhutani Iti Kalaha. Meaning that it doesn't omit even a tiny fraction. That the Kala is cannot be expelled. Takra Sangra says Atiyadi Vaharana Hetu Kala Sa Eko Vibhur Nityascha. The Kala is explained as the cause of reference, like past, and it is only one when which is omnipresent and eternal. Time cannot be measured by normal way. So we use sun as a reference to make measure Kala. All the Shastras use sun to present time. That is, Jyotishastra and Ayurveda uses Kala Vibhaga for understanding the changes. In the in the context of the time, it relates to the change in climate, that is Rutu Kala. Change in the body. In females, it is Rutucharya, and in disease, it is Kriya Kala. Changes in drug efficiency, that is like Asavaristas. When it is kept for a long time, it gives you the efficiency. Changes in daily activities, that the per day 3 dosha cycles is explained in all the Samhitas. And changes in the day and night cycle, that is Dinacharya and Rutucharya is also explained separately. So we have acute and chronicity in diseases. One example from Charaka Chikitsasthana, Jorada Dhyadya, it says that Langanam Sedam Kalo. That word Kala represents Ashtaha, means in Chakrapani says that Ashtaha. That the disease Jwara, 8 days before and 8 days after, it has separated Jwara into two variants. That is 8 days is Navajwara, and after 8 days is Purana Jwarana. So based on that, the treatment changes. So it is said that Kala is very important to understand the disease. And Kala and Dasha is included in Navakarana Dravyas, which again it says the importance of Kala.
Coming to one of the most important pariksha, that is pravruti. So Acharya has told pravruti as pravrutihi pratikarma samarambha. So it is called as the initiation of an action. So whenever there is a patient, if he comes to us, all assessments, pariksha, everything is done. But when the doctor is initiating, that is called as pravruti. We can consider 2-3 aspects in pravruti. First, kriya, karma, and cheshta. These can be called as a synonyms of pravruti. It is the initiation of an action for the accomplishment of a specific objective. This is the effort and also the beginning of the action. So according to the modern science and the modern aspects, the ethical and the scientific aspects can be considered under pravruti. So whenever there is a patient, when he comes to us, you need to examine, act accordingly, and then initiate the action. Before examining and before thinking what to do, you cannot initiate any kind of chikitsa. So one more aspect which comes under pravruti is sadhya and asadhyata. So whenever it is told in Samhita that before starting any treatment, one should always think about sadhya and asadhyata. So if the patient is having any sadhya vyadhi, then the treatment can be given. And if it is asadhya vyadhi, then the patient should either be referred or recommended somewhere else. That is told. That also comes under pravruti. So the last Dashavidha pariksha is upaya. So upaya can be called as the excellence. You know, whenever you're examining or you're treating, the excellent part, the excellent thing which you do is called as the upaya. For example, in Charaka Sutra 25th chapter in Yajapurusha Adhyaya, Agre Aushadhis are told. There are so many drugs and so many chikitsas explained everywhere. But Agre Aushadhis are told separately because they are called as excellent drugs. That is what is upaya. One more example is in Rakta Mokshana reference, it is told that if there is Pitta Prakopa, if you're doing Rakta Mokshana and there is Pitta Prakopa, you should always use Jaloka. In Vata Prakopa, you should use Shringa, and in Kapha Prakopa, you should use Alabo. So all these things should be specifically examined. This comes under Upaya. And in you can also correlate this with Kala also. Correct? Kala. Acharyas have explained Aushadha Sevana Kala. So all these Aushadha for specific disease should be given in a specific Kala. That is very important. If there is an Apanavata problem, there is Apanavata disturbance. If you give medicine in some other Kala, it may not work. It is told in Apanavata Vikruti, Prag Bhakta should be given. That the medicine should be given before food, which is very important. That is why Upaya is very important. These two aspects explain all the kinds of pariksha.
All right. Completed your time for the second round. Give a big round of applause for the Stapna members from KLA Ayurveda Mahavidyalaya, Belagavi. I take this opportunity to welcome most respected Dr. Radhakrishna Sarji, that is Principal Government Ayurveda Medical College, Mysore. Welcome you, sir, to this 8th Samvada National Level Scientific Debate.
Thank you. Thank you, sir.
Thank you, sir. Thank you so much. Now, second round is completed by Sthapna members. They have mentioned that how the Karana, Karana, Karya Yoni, Karya, Karyaphala, Anubandha, Desha, and in Desha, Bhumi Desha, Atura Desha, and in Atura Desha, how the Dashavidha other examination should be done there, and importance of Kala and Pravritti, Upaya. These are all to be examined, and these are the most ideal method of examining the patient and understanding the disease and giving the treatment which is apt for that particular condition of the patient. Now moving towards these Pratisthapana members, how Dashavidha parikshas are not that much important, and how the other parikshas are more important than the Dashavidha pariksha. For substantiation, I would like to call Stapna members to put forth their statement in justification for the statement they have given for the Prathama Varta. Over to Pratishtapana members.
Thank you, sir. Repeating our Pratishtapana. Dasha eva pariksha vishesha parikshitavya paryaptam na bhavati. Only Dashavidha pariksha are not sufficient to be examined in patient. Before beginning our reasoning, let us know what is pariksha. Pariksha is parikshate vyavasthapyante vastu sarupa maniyeti pariksha pramanani. So from which we get the vastu swarupa gnana is called pramana or pariksha. So vastu swarupa gnana here refers to karma darshan janita gnana, that is gnana related to the roga and rogi. As Ayurveda prayojana, it says dhatu samyam priyachokta tantrasyasya prayojanam. Dhatu vaishamya is one which has preceded dhatu satmya. Hence dhatu vaishamya refers to vikara. Here vikara, that is roga. As roga is ashrita in the rogi, roga pariksha becomes our first approach before giving any treatment. So as I always said, drujatiti roga. So roga can be identified by the specific clinical features portrayed by the patient, and only after that examination and analysis we can move on further. Hence it will be apt to quote here, rogamadu pariksheta tato anantaram aushadam tatah karma bishak paschat dhanapurvam samacharit. Hence rogam ado pariksheta is what we quote here. And there are many kinds of parikshas where it is also quoted bahuvidam hi pariksha tata pariksha vidibheda. Hence, which is the most aptful or the first foundation pariksha? Again, we go for the Charaka Acharya quoted shloka, where Esha pariksha nasti anya yaya sarvam parikshate. Pariksham sat asat chaiva tatha chasti punarbhava. This is in reference to the Chaturvidha pariksha, Aptopadesha, Anumana, Pratyaksha, and Yukti. As we know, Madhava Nidana, as stated, dosha dusha sammurchana vishesho jwaradi rupo bhavati. Hence, jwaradi rogas are always because of dosha dusha sammurchana. Yet, we have an amalgamation of three things here, that is pramanas, nidana panchaka, and kriya kala. Only through this we can aptly know what is the roga, hence the same lakshana in the rogi. Stating few limitations of Dashavidha pariksha in few aspects, that is as of samprapti yatha dushtina doshine yatha cha anuvisarpata nivritti amayasyasu sampraptir jatiragati. So this anuvisarpata of the dosha cannot be aptly assessed with just Dashavidha pariksha. Kha vaigunya in srotas kupitanam hi doshanam shariram paridhavitam yatra sangha kha vaigunya tatra vyadhi upajayate. So sthana where kha vaigunya happens, again it is anumanagamya. Just with Dashavidha pariksha bhavas we cannot analyze it. Srota Vimana has stated initially, Sharira Drishta, Adrishta Srotas has to be examined. Again, this holds this time where only Dashavidha pariksha cannot do it. Mano Artha Vyavicharana Bhavas. Just Sattva pariksha can tell the Manobala, but Mano Vishayas in detail has to be again gone through Anumanagamya Bhavas. Finally, Vikara Vighatakara Bhavas written in Prameha Nidhana. These things, though it is an amalgamation of Nidana Dosha Doshya, but still Anubadnati has to be assessed again by the with the help of Kriya Kala, Nidana Panchaka, and Pramanas.
Substantiating our second pratigna, as per the second half of the title, the Karana will not become a Pariksha Bhava. 10 means of knowledge for physician. Jnana Purakam hi karmanam samarambam prashasanti kushalaha jnatva hi karanam karana karyayoni karya karyaphala anupanda desha kala pravrutti upaya samagabhinivrittamana karyabhinivritta. Hence, Vaidya is rogishu karanam na bhavati. That is, he will not become a factor in rogi pariksha. Paryavadat shutam paridrushta karmanam daksha dakshinam shuchi jitahastata upakaranavantam sarvendriya upapanna prakrutijna pratipatijnam. These are the qualities of Bishak. The one who is having the above said qualities will become successful in his treatment. In Dashavidha Pariksha Bhava, Vaidya won't come because he is the one who will examine the Prakrutadi Bhavas in Atura. Yata Chikitsaka Swayam Karina na bhavati, evam Vaidya Kadapi Parikshaha na bhavati. The 10 components of Dashavidha Atura Pariksha, Prakriti, Vikruti, Sara, Samhanana, Pramana, Satmya, Sattva, Ahara Shakti, Vyayama Shakti, Vaya. These factors mentioned specifically in Samhita under same context for Atura Desha Pariksha. So Bishak nowhere become the part of Atura Pariksha.
Presenting our third pratigna, kevalam Dashavidha pariksha vidaya paryaptam na santi roginam parikshitum. Relying solely on the Dashavidha Atura Pariksha will not be sufficient. To state this, according to the Samana Tantra Pratyaya, Acharya Charaka has not mentioned only Dashavidha Pariksha to be examined in all the contexts. In other words, Acharya Charaka highlighted the importance of the need of other parikshas or the limit of Dashavidha Pariksha in different contexts. One such context is while administrating the Virechana Aushadha on the day of Virechana Karma, one has to examine dosha, vishesha, desha, kala, bala, sharira, ahara, satmya, sattva, prakriti, bias, and avastha of the vikara. These are the 12 factors which have to be examined before administrating the Virechana Dravya for a proper Shodhana. Here, the Vidana Tantra Yukti has to be highlighted. Again, Acharya Charaka in Indriya Sthana as mentioned, Iha Kalu Varnascha, Swarascha, Gandhascha, and Rasascha, Spashascha, etc. More than 15 factors for the assessment of Ayu, Shesha Ayu with the help of the Pramanas. With these examples, it is clear that Acharya has not only upheld the Dashavidha, and it is also clear that by these examples that Niyoga Tantra Ukti has not been justified. Hence, we cannot use only Dashavidha parikshas in all the contexts mentioned by Acharya Charaka. In the Paratantra Pratyaya, it is to be highlighted that for examination of the Swasthana Pariksha in the Rogi, Roga Ratnakara has stated that Yoga Krantam Sharirasya Sthanani Ashtau Parikshe Nadi Mutra Mala Jivha Shabda Spasha Druk Akriti. And with the help of example, I would like to highlight that to differentiate the Anukta Vyadi, whether it is the Kulaja originated, only through Dashavidha Pariksha it is said to be limited. But Yoga Ratnakara states that this can be possible by Taila Bindu Pariksha. And recently, the SRM Institute has taken patency for Taila Bindu Pariksha. In one of their articles, they have stated that Sadhya Asadhyata of the Rogi can be assessed through Taila Bindu Pariksha. There is a reference in Sushrutam Samhita that Mala Pariksha has to be done to assess the Amavastha, where it is highlighting that examination of the Mala is also important to check the avastha of the rogi. In Aturupakramaniya Adhyaya of Shushutacharya stated that Roga Vishak Ayur Adav Evam Parikshitavya Sati Ayushi Vyadi Rutu Agni Vaya Desha Bala Sattva Satmya Prakriti Vesha Veshaja Doshan Parikshet, where he explains 12 factors which has to be examined before conducting any treatment. Here, based on the Vidana Tantra Yukti, it is implied that the first primary assessment should be the Ayu. According to Ashtanga Hridaya, Acharya have mentioned Darshana, Sparshana, and Prashna Pariksheta cha Roginam. And he also mentioned 11 factors which are to be assessed in the Rogi are Dushya, Desha, Bala, Kala, Anala, Prakriti, Vaya, Sattva, Satmya, Ahara, and Avastha. And Sharangadhara has stated Nadi Pariksha, and he has given an importance to the Nadi Pariksha, stating that Jiva Sakshini Damani Pariksha has to be done to assess the Sukha Dukkha of the Kaya. By this, I would like to say that Dashavidha Pariksha Bhava are not accepted by all the acharyas, as it is the Paritita Tantra Siddhanta, where Pratitantra Siddhanta states that Pratitantra Siddhanto Nama Tasmin Ekaik Asmin Tat Prasiddhaha, which means Siddhanta with or opinion which varies according to the different authors or tantras. Even though Shiras is a component or uttamanga of the Sharira, but it does not mean that whole Sharira constitute only with the Shiras. In the same way, along with Dashavidha Pariksha, other parikshas are also essential to complete Rogi Pariksha.
Substantiating our fourth pratigna, that is apatkalike paristitishu Dashavidha Pariksha na pradhana pariksha bhavati. In Samhitas, to denote emergency condition, acharyas have quoted the word atyayika in different contexts. And for the management of such conditions, words like Tvaraya Jayet, Tvaraya Buddha, and Ashu are mentioned because Vaidya should take immediate steps for the prana rakshana of Rogi. I'm taking an example of sannyasa here. There it states that pranay vyujyate shigram muktva sadhya falakriya from Charaka Sutra. Means Vaidya should take immediate steps for the recovery of such persons, otherwise he will land up in collapse. In the sannyasa avastha, performing Dashavidha pariksha sounds impractical. There are some other references or context supporting the same. That is, in the condition of abhigata to sadhyo pranahara marma, death occurs because prana resides in marma. Hence, quick measures should be taken to protect prana. The shloka states that Tesham Trayanam Anyatamasya Api Bedadasya Eva Sharira Beda from Charaka Siddhi. In different Atayika Avastha, Vaidya can go for needed specific examinations. Supporting this, in Vishachikitsa, it is mentioned that generally for Vishagrasta, after assessing Doshabala, Chikitsa should be given. That is, Kuryat Bishak Chikitsam Doshabalam Chaivahi Samiksha. I am quoting an example of Kantashalya from Shalya Apaniya Adhyaya. Here, Shalya lords in Kanta. Kanta is one among the Dasha Pranayatana. Any injury to this leads to Pranagata and hence should be managed early without any delay. And even in Yuddhabhumi Chikitsa, it mentions that to remove Shalya from Anga, we should first notice what is the sthana of the Shalya present. Then in Janapadodvamsa, when epidemic outbreak occurs, we get a task of handling mass emergency cases. During that time, performing Dashavidha pariksha to each affected individual is not possible, and it even applies in disaster condition too. Thus, emergency conditions are such where, if not treated, takes away the one's life, like how fire destroys entire forest. Thus, I want to conclude that in emergency situations, Dashavidha pariksha cannot be considered as the primary examination.
Substantiating our fifth pratigna, we know that Eko Shastra Madhyano Na Vidyat Shastra Nishchayam Tasmat Bahushruta Shastram Vichaniya Chikitsakah. To gain a deeper understanding of our science, it's essential to also explore other sciences or Shastras. This broader knowledge enriches our comprehension and perspective. When it comes to Vadi Pariksha, I find ourselves struggling to understand Nidana Panchakas when it comes to Anukta Vadis. One such prevalent issue in our society is cancer. I would like to quote an article titled Understanding the Etiopathogenesis and Diagnosis of Malignancy in the Framework of Ayurveda It was a study done taking 4 decades of thorough observation. Here, the author has meticulously examined malignancy. He has reviewed and what exactly could be understood in terms of Ayurveda was explained with respect to Udara and Abhyantara Vikruti. In the same way, concept like Krimi can be explored with the help of the science like microbiology. When it comes to Roga Pariksha, we have many references in Samhitas highlighting the importance given to physical examination of patient for Vadi Nischayartha purpose. For the same, in the context of Ridrasi, Shushruta Samhita says, Satnaha Kshepam Nigrihniyat Kridrasi iti Sasmrita. And in Plihodara, he says, Kachapa Samsthana Upalabhyate. So, now that we have detailed methods of systemic examination, we can adopt accordingly and allowing for a comprehensive understanding of Ayurveda Pariksha Vidhividhanartha told specifically for Vadi Nischayartha. Supporting it by including the same in the syllabus of Ayurveda is a welcoming step by NCISF. Integration of modern tools and investigation. Hypertension, we know that encountering a 12.8% of total of all deaths. Diagnosis of this disease relies basically on blood pressure monitoring using tools like sphygmomanometer and stethoscope. So in such diseases, saying no to tools is very difficult. As a prophylactic care, an example we have evolved with the technology. To quote that, I can say as a prophylactic care, we have adopted ECG and blood pressure monitoring to rule out contraindications like Hridroga before and during the procedures like Vamanadi, Shodhana procedures. This shows the need of proper amalgamation of modern tools in present day. Coming to the modern investigations, many serious diseases in present day stays in latent period for long time. So assessing the Vadi Avastha here becomes the difficult. Example, in coronary artery disease, to know the site of the artery and the state of the artery, grading of blockage, we cannot justify it only through Vikriti Pariksha. We need help of advanced scientific technologies like ECG and echo. Coming to the evidence-based medicine, okay, I would like to quote one last article that is by B.S. Prasad sir, where he has done Reto Dushti Pariksha through sperm analysis, semen analysis parameters. So like this, he had even included in one article, unless and until doors are not opened for basic sciences in Ayurveda, multidimensional and integrated research development are not possible in Ayurveda. So kalo hi parinama uchyate, changes are inevitable with passing time. Keeping core principles of Ayurveda intact, we can give new horizon to the science to reach at global platform through scientific research when it is appropriately blended with modern tools and investigation and technology. Thank you.
Thank you, Pradeshtapna members, for your wonderful substantiation and justification for the statement which you are against the Sthapna statement. I would like to recall the points which are put forth by Pradeshtapna members in the assembled hall. That is, even the both team are talking about Dhatu Samyata, but the way of Dhatu Samyata is different from each group. One group is telling that the Dashavidha pariksha vishesha are important, whereas the Samprapti's type of point which will not come under the Dashavidha pariksha yatha dushtena doshena yatha chanu visarpata nivritti ramasyasu samprapti or kupitanam hi doshanam sharire parivittu. That Samprapti is not going to be in this pariksha of Dashavidha. And in Vikara Vigatakara Bhava Bhava, Anubudhyati to be assessed, which overcomes what? That is important. And also, the Karna, the physician, which is considered, who is considered as Karna for everything, that is not a point of examination in this, according to the Pradishtapna members, and they are giving much importance to Atura Pariksha there. And also, they are talking about Vidhana, Tantrikti, and also the Samuchaya Tantrikti, which they are utilizing from Indriya Sthana, Idam cha, etc., Varnaswani Adhyaya. That also to be examined properly. And also the Sharangadhara Sangita explains Nadi, Jiva Nadi, etc., and pulse examination or whatever the examination we do in today's practice, that is more important. And also, Pratitantra Siddhanta is also acceptable in Ayurveda. Sarvatantra Siddhanta, Pratitantra Siddhanta, Adhikarana, Abhibhagama Siddhanta, Tasmin Ekaikas Tasmin Tat Prasiddham. I understand. The Pratitantra Siddhanta is also important as Tantra Apcharaka Samhita here in Kaya Chikitsa. And also, the Adi Chikitsa, in emergency condition, you cannot assess how the Karana is, how the Karana, how the Karya Yoni, Upaya, etc. But in emergency condition, what is needed instantly, that need to be given for the patients. And also, the doctor or Ayurveda Acharya should be Bahushruta. And he should respect the Paratantra also. So that way, it is very important as the modern investigation or Western investigation. I should not use modern because our science would be old. Okay, but yet the golden system we have, we can call it as Western science and develop Ayurveda as a Indian science here. ECG and also echo, whatever we do these days for the examination of the patient and also have the diagnosis of the patient proper. And then only we can proceed a proper treatment and get succeeded in the chikitsa. Not Dashavidha pariksha only important to be examined in patient. There are other parameters to be examined properly. Is the justification given by Pradeshtapna members. Big round of applause by Pradeshtapna members for putting for their statement beautifully. Now, it is time to move towards the third round in connection with the second round, that is Dvitiya Vartula. Now, it is important to have Vitandavadins against Sthapna and Pradeshtapna. Now, we take up the questions, queries against Sthapna. I request Vitandavadins, what are your queries? How Dashavidha Pariksha is not important. How Dashavidha Pariksha is for Sthapna, what they are telling. How the wrangling is from your end. Vitandavadins, kindly. Proceed with session.
During the examination of Dasha pariksha, how relevant is to examine the Bhumi Desha while treating the while doing the Atyayika Chikitsa? What is the relevance of doing the Bhumi Desha pariksha during the Atyayika Chikitsa?
Videsha it is concerned with the case where the person is presently living, and one more is where the actual things are, or the whatever pathology has happened. It may be atyayika condition, but the condition may be in a less symptomatic in initial stages if we have left it alone, or else we have not treated in a starting condition, then only we are leading in a atyayika condition. So in such a conditions, the Desha is going to, Bhumi is going to be helpful. How it means? So whenever you have any conditions like our Anupadesha and Changamadesha. So we have the things. So in that, so some diseases have been explained. So in this region or in this Bhumi condition, so we will get the such a diseases, and we are going to treat it with a examination part of a Bhumi and Desha. It depends on the physician how they are going to examine. Again, it is a quality of a bishop. So we want to examine the Bhumi Desha along with a bishop also. So it is important to have a Bhumi in Atyayika conditions also.
Yes, yes. The query of Yuthandavadin sees how in emergency condition, the Desha Pariksha is going to be helpful. And for Pratistapana, it is more emergency to have the information of Desha for them. The answer. Okay.
Also, in emergency condition, it is necessary to take the history of the patient about the drug allergy and food allergy. That also need to examine. So in that context, Atura Bhumi also plays important role in that.
The patient is unconscious.
I think that will be there now with them.
They will know about the drug allergies.
No, meaning drug allergy, or you are quoting about regarding like poisoning cases, or
she just said that
it's. I think if a patient is in emergency condition, somebody brought to the hospital in emergency condition, they don't having any attender, and the attender who is attending that patient don't know about anything about patient. How much time you take to understand the patient?
See here, Dashavidha pariksha is said. Dashavidha pariksha bhava is not only Desha. So we will think, okay, based on the other symptoms and signs, we can see the patient and we can examine. We should not keep only Desha, and we didn't say that we are not going to only use Desha and classify that, right? We have going to use other 9 things. So the doctor should understand the condition. Then you have to treat the patient. Okay. Not only keeping Desha, we cannot treat the patient, remember.
Next. Be quick. Yuthandavadins. Now it is your time to utilize that max.
so the conclusion is Dashavidha parikshas are not important in Atyayika Chikitsas, right?
See, Dashavidha pariksha is.
You mean Navavidha parikshas are important?
Vida or Ashtavidha?
Yes. No. Dashavidha pariksha contains all.
Some of the Dashavidha parikshas.
Some of the Dashavidha pariksha, all 10 Dashavidha pariksha has its own unique criteria. Okay. All other parikshas come under it. We are saying from the start that it is a systematic, way of approach towards a disease and treatment relationship.
All are important.
All are important.
Considering the importance as per the patient's requirement, they are utilizing and modeling. Okay.
So apart from emergency conditions, in other conditions, you assess all the Dashavidha parikshas.
Whenever in which conditions, what things should be examined, that should be known by the physician, and according to that, we have to act, we have to pick the whatever things should be examined.
So you are saying that it is not necessary to do all the 10 pariksha, 10 examinations in each patient.
All
you do
parikshas are required for all the condition of the patients. Yes or no?
Leave about the emergency condition. In other condition, whether all the 10 are required or some of them are required.
All the 10 are required, but the condition differs.
Okay, all are required, but condition is different. Okay.
Sir, one more point. All are interlinked also. See, if you understand each and everything step by step, you can go and give medicine to the patient. Okay. So you cannot keep only Dasha, you cannot keep only Kala and give a patient a treatment. Okay. You should understand the patient condition. You should say example. I have one example which I didn't quote here. In Mutra Stila, okay, the patient, you should know what is the condition of the patient first. Then we have to think what drug can be given. You have to understand where the patient has come from. So we have to see all the criterias. Then that is only it is given in Dashavidha pariksha bhava. It is a step-wise manner. First, the patient, the doctor should be knowing the disease. All of us are not well versed in all samhitas or all the disorders. Okay, so particular doctors are given. If you want to if you want to become that much pariksha, you should be an apta. Okay, we are not higher aptas. Okay, it is given in Shastra only that the doctor should be devoid of rajas and tamas. Here we don't know who is sattva. Okay, so everything is needed for understanding a disease and treating it accordingly and getting the phala. Okay, so we cannot say that we need only the Dasha, we need only the Kala, we need only Atura. Like that, we didn't say that. We need all the things which should be going systematically. Then only the outcome will be there.
Start only we have quoted everything in a synchronized manner. That is what is the truth. Dashavidha pariksha bhava.
Everything is in synchronized manner and you are examining the patient through all Dashavidha parikshas and you are diagnosed this disease. What if the patient is malingering?
Please repeat your question.
If the patient is malingering and the physician has done all the Dashavidha parikshas and came to an conclusion that he is having some diseases. After that, if the patient is malingering, how can he diagnose the disease correctly and how can we accept that he is correctly diagnosed the disease?
Can you pick up the question and answer?
If the patient is malingering, there is one concept that Acharya Charaka and Bhagavata has beautifully explained, like the concept of Tyajya Rogi. Then you should leave that patient. Even if you are giving the treatment, that patient is not going to take any benefit from that.
Then Dashavidha, while explaining Dashavidha pariksha, you could have mentioned that we should, who are the Tyajya Rogis and who should be included in treatment and all.
I told that in Pravritti. You have to initiate. You have to know what to initiate. The patient is not accepting, reject. That's it. That is the initiation. That's it.
After initiation, when you came to know that he is malingering, even though if you not came to know that he is malingering, then whatever the treatment you are giving to him, it's going to be fail only. No?
See, we are rejected. See, if you are taking treatment to me, and you in the course of time you are saying that my medicine is not working. Okay, I have done everything and have supported you, but based on your criteria, your mana bhava, you have come to the conclusion that it's not working. There is a possibility you can reject me or I can reject you. It is given in Karana only. Okay, both can done. In Vaisa only we have kept forward the Karana. If you want, yes, you can reject in the start only now.
Yes, Vidantavadins are picking up very good question. Give a big round of applause. Vidantavadins also in this debate. Next question I can stop now. Any questions remained unanswered or any wrangling?
In Karana, it told that Daiva Vapashya Chikitsa, while treating a patient, how you will assess by giving Daiva Vapashya Chikitsa and Dhatu Samyata?
See, in Kala, I have said when I was explaining, Jyotishastra is there. Okay. It also comes under Kala. Again, I'm saying. Deva Pasha Chikitsa relates to what? That Purva Janma Papa Kruta, what we have done, that has come as a disease or disorder. When we are giving Deva Pasha Chikitsa, we should know what type of karma we have done. So we will use Jyotishastra. Okay. By using Jyotishastra, we can find that which type of graha is involved in doing this problem. And we can give treatment as well as type of mantra. Actually, it said in our classical also, mantra, homa, dhyana, dharana, and all. So we can give according to that. We have to plan. The thing is, you have to know the additional knowledge of Jyotish Shastra and the other things of mantra jnana. That's it. This is my
Okay, okay, okay. Now, Vitandavadi will complete their queries against Sthapna. Now, again, Pratisthapna will be against Sthapna for the queries, and Vitandavadi will get chance against Pratisthapna after this. Okay. Over to Pratisthapna against Sthapna. What are your queries? How Dashavidha pariksha is not important?
It should be clear that Dashavidha pariksha in Atura or Dashavidha pariksha. In the second half of the topic, it is mentioned that it is in patient. So it should be clear that Dashavidha pariksha in patient means this is Atura pariksha. So we are not considering Karana here. We have already justified in the second pratigna. You are telling that Dhatu Samya has to be assessed. Before that, you have to assess the rogi. And you are telling that the sequential manner has to be maintained. How far sequential manner will be helpful in assessing Atyayika Chikitsa also? And how many conditions can you tell the examples where
Yes.
sequential manner?
Keep it in short, okay, because we get confused. Even I am also getting confused. Okay. You are mentioning about Vidhana, systematic presentation, systematic approach. How about the Ati Chikitsa where the systemic approach is not going to be missed by you? Are you sure that it is not going to be missed in Ati Chikitsa? As you missed one point, told that Nama with the parikshas are important in some context. Is it not missing a krama?
No, sir, you don't miss the krama actually. If a patient in Atyayika condition also is coming to you, first what you have to assess, like if a person is coming with, he is having a bleeding from his head, first you will assess the vitals or first you will go for stitching directly? That you have to see, na? That will come under Karana. And what are things you need? First, you have to assess that. Then only you can go for the treatment. That only comes under pariksha, and that is the pariksha.
Whenever we have a Atyayika condition, so you have quoted one example, like any Kantakata Shalya is there. So in any foreign bodies in the throat, or you assume any foreign bodies in the ear. So how we are going to be taken it out? So that should be in a one sequential manner. So first the physician is capable of doing or not. So that is Karana, nothing but. So next is Karana we are having. So our instrument, whatever we are going to use, so those are suitable or not. So those are well working or not. So if you are using any endoscopic view, so your endoscopic camera should be properly work. So that is the main thing. So in a sequential manner, we have to approach, and after that, so Karya Yoni we are having. So how to use the instrument. So Bishop should be able to handle the instrument properly. So where the FB or foreign body is there, so in which way you are going to approach, so from which way you are going to take it out, either you are going to use only instrument, so or else you are going to use any oral syringing, and also that all things should be considered and should be used. Again, the Karyaphala we have included, like after that you remove the foreign body, what are the things that made into the canal or whatever thing we have operated.
Result. Okay.
So these all things should be seen, and these all things. So if you're going to see the Dashavidha pariksha in each of the every concept, it is a applied aspect. So we can't take it as ki you have quoted like modern technologies should be used. Yes, it should be used. It all comes under the Karana, what they have mentioned. So whenever you are going to use any endoscopic instruments or the any OT instruments or the any USG X-ray parameters, that all are the Karana. That should be well worked. If it worked only, we can diagnose and we can treat the conditions.
Yes, as far as Dr. Raghavendra, the NCISM is also apta for us, which she has given the list of instruments to use for different departments. Okay, so enlisted equipments are there. Okay, now any queries remained unanswered or you are not satisfied, that also you tell.
Like we want to clear our pratigna properly. Like in second pratigna, we said Bishak is not a pariksha bhava in Atura. Means physician is not a object or is not a factor while in examination of patient. In our fourth pratigna, we have stated that in emergency situation, Dashavidha pariksha cannot be considered as a primary examination. So we have different pratignas. different hetus and different drishtantas. So from one pratigna, you can't correlate to another pratigna. So we are given clarification in our second pratigna itself, like how Bishak is not a pariksha bhava in Atura. When it comes to Atyaika, like which is the fourth pratigna, as your team mentioned, like you have to go by sequential order. See, not only in sannyasa, I want to like acharyas in many contexts of the Atyayika, they have even used the word Atyayika, Tvaraya Jayat in the, like they have mentioned these words in some many slokas, right? There they have mentioned like after signs and symptoms, they have directly gone to treatment. For example, if you take Shwasa or Hikka, there if Vega comes, they have mentioned to apply after Lavana Taila. There they have not mentioned, no, it should be applied, this Taila should be applied in Vata Prakriti, Pitta Prakriti, Kapha Prakriti. No, if it is Atmaika condition, you directly go for first treatment. Prana Rakshana, it should be our primary goal of a Vaidya. And even for a Vaidya, there is actually a reference like primary goal of Vaidya is to give Ayusha and Sukha. So that should be our primary motto while treating Atayika Chikitsa. And you mentioned no before, like you can assess one or the two factors of Dashavidha pariksha in Atyayika condition. What I want to clear is, even if you want to test one or two factors, but all others are not considered, right? Then how it becomes Dashavidha? And even only, you have taken only Dashavidha pariksha in Athura. So even in Atyayika and different avastha, for example, as I quoted before in Vishavega, like any kind of Visha, before that we have to assess dosha bala. That is for Visha.
Doctor, all these, which is your question?
No, sir. Actually,
one question. You raise one question.
We are not questioning actually them. We are
No, justification from your end you can give later when others ask you about your justification. Now ask the question about their points which are not apt as per you.
I want to get clear, sir. Dasha eva pariksha vishesha parikshitavya. And next part is only Dashavidha pariksha is to be examined in patient. Is karana, beshaja, and other factors like other mainly will be karana, well vision, can be a part of a patient. Like prakriti vikruti will be in the pariksha, the patient.
How these 10 be part of patient?
Yeah. That will be
Simple,
not a part of patient.
One simple statement. I think much time ask this question. Okay. Good have
Athura pariksha we are having. So for the benefit of a patient, so we are going to do the things all. So whatever 10 we have mentioned, it is for a beneficial of the patient. So for if you want to treat the patient correctly, then first is capability of the physician whether to treat or to refer. So here it includes under the Dashavidha pariksha.
Yeah. Now next question. Pratishtha. Any Pratishtha members of yes have any queries against the Sthapana? Last question against them.
One of the member of Sthapana mentioned Jyotishya Shastra need to be known very much in detail. So is it included in Dashavidha pariksha to like Jyotishya Shastra? It's again you're proving our pratigna fifth, that is Eko Shastram Abhiyano Nani.
Yes.
So
Now
we
they
should
are
refer Bahushastra. So that is the point.
Yeah, Jyotish Shastra, where you have brought this point in Dashavidha Pariksha, Jyotisha Shastra, if at all you are considering that, again it would be Paratantra Avalokana or Pratitantra Siddhantas, etc. are there, elaborately explained by other tantras, and you are utilizing.
Actually, Jyotish Shastra, I have what it is. It is also, if you see the Jyotish Shastra, not only Jyotish Shastra, if you see any Ayurvedic concept, it comes from which Veda? Atharva Veda. Like, okay, everything comes like this Jyotish Shastra also comes from that Veda. So it is said that not only Jyotish Shastra is considered as like other Vedas, okay, other part of the subject. Okay, Jyotish Shastra is also clearly said as a eye of, like, it gives a clarity for anything to be happening. Okay, so in this, I have specifically brought that into Kala because Jyotish Shastra mainly speaks about the Vali Kala, not any other things. Okay, in by seeing that Kala, they have examined, like Acharyas have done some examination and found that these Vyadis will be present in this person in this type of Graha Upayas. Okay, if you see in letters, authors of Ayurveda also, in Basavarajan context, karma vyapa chikitsa is given. In that, if you specifically see, Damavata is caused by
That
absence
is
of
the question. If you want to take Basavarajya for
Sir,
your reference, why not Sharangadhara?
Sir,
Why not
that is-
Yoga Ratnakara? Is their question. Is it not your question?
Sir, all we are saying that all other parikshas comes under Dashavidha pariksha because it's a line way, so to say. It is a systemic
Okay,
ways.
even though it is pariksha bhava, but still they are going to fall under this Dashavidha.
Everything comes under Dashavidha
Is
pariksha.
the answer from their end. Okay. However, it is going to be endless discussion. We need to give a pause to that. Now, Vitandavadins against Pratisthapana and later Sthapana against Pratisthapana. Over to Vitandavadins. What is your problem? Why you are not uh, having an agreement with the statement given by Pratisthapana? Why other parikshas are not important? What are your queries against Pratisthapana?
Kriyakala only assess the avastapta dosha, but while planning the treatment, we need a rogi bala. Point clear. We are not telling that Dashavidha pariksha is not important or not will not be done in the patient. We are telling that along with Dashavidha pariksha, other parikshas are important. So, for your, can I?
No, she has not asked any question till now. She has made one statement. Okay. Can you repeat that?
Kriyakala, we will only assess the Vyadhi avastha. But we need to plan the treatment, we need Rogi Bala also. Answer for the same.
Yes, yes, yes. Proceed with next question. Next. Be quick, be quick.
Patients like HIV and all, as you mentioned, either it may be through all and in Nidana Panchaka Upashaya and
Doctor, which your group? Asking this group, no? Okay.
by using any other parikshas also. Do you have any upashaya or through Dashavidha pariksha upaya for that disease?
To be specific, the topic is only Dashavidha pariksha is to be examined patient. So Atura pariksha is being highlighted. We are not talking about upashaya, but for your question,
Vidana Panchaka you have mentioned, no?
Good Lingartha Pariksha Yavan Upashaya and Upashaya. And she is taking the example of HIV infected patient. How it is to be understood through your points. That is Upashaya and Upashaya Abhyam.
According to recent sciences, this HIV is an Upasargika Vyadhi, which can be assessed with the history taking, where Prashna Pariksha and Pramanas have an important role. Upashaya and Upashaya, it's not need to be that Upashaya and Upashaya should be for every diseases. It depends on the condition and avastha. We cannot state in HIV Upashaya and Upashaya, we cannot state that. That depends on the condition. Maybe in Amavata, we can state Upashaya and Upashaya like that. And it is a good, in Gudalinga Vyadhis, we can state Upashaya. But in HIV patient, some bala will be getting hampered, right? That will be assessed by the symptoms, or we can take the history of the patient. Then we'll get to know the condition and diagnosis can be made from that. And by using investigations also, we can find the HIV patients. Unless until patients come and complains, you will not be getting to know that patient is having HIV.
Okay, if you came to know that patient is having HIV and all, if you have mentioned that other parikshas are also very important along with the Dashavidha parikshas, you could have mentioned that in such conditions, it's not going to be happen, or we can not take any chances to examine or treating the disease. You could have mentioned in that also exceptional conditions.
Basically, it is an ethical consideration that we cannot deny any patient of the treatment, may it be HIV or any HBsAg conditions. So, as we already mentioned in fifth pratigna, keeping the core principles of Ayurveda in respect, and again with the amalgamation of the modern technologies, first of all, we have to know what is the vyadhi, that is what is the type of the roga. Only when we know the severity, that is with its brudu or dharana, as in Anumana Gamya, they've already stated that the brudu dharunatva of the roga can be assessed through Anumana Gamya bhavas also. So
with again the interrogation or prashna. So when we get to know about the nature of the vyadhi itself, of the vikara, then based upon that, we can again, in the consideration of all the other factors, we can state whether we can give treatment or not. Otherwise, again, it's always said, and we have also accepted in the fifth pratigna, referring the patient is also a prime duty of the doctor. So as it's already said in Charaka Samhita also in few conditions, Dhanvantri Sampradaya has been followed by Charaka initially. So in this model, like in this present era,
No, is there
referring
any
the-
upashay, anupashay HIV patient?
like, I think that,
There has to be or no?
but as per respect to the examination and upashaya and pashaya,
Or is
question
it very easy to diagnose? Shosha, Rajayakshma.
Sir, we are not.
Why you need a good Arthalinga pariksha?
Sir, we are not stating all the diseases can be assessed by upashaya and anupashaya. Some of the diseases can be assessed by upashaya and anupashaya, where diseases where there will be a gudalinga. Here we are not telling that HIV is having a gudalinga.
Yeah,
And
that is a ranking question. By where?
We are not sticking to only HIV or AIDS for assessing.
Giving an example that in such conditions, which which are the diseases, you are not going to do upashaya and anupashaya.
Like add on to my like team members' point, since HIV is not a condition where we have the Gudalinga, then there is no need to assess this Upashaya and Upashaya. No, in Agra it is mentioned Gudalingam Upashaya Anupashaya Abhyam.
Then accept Dasha along with Dasha.
Nidana Panchakas. You are also missing one point among Nidana Pariksha. And how do you say that they are missing one question among Dashavidha? You are also missing one
So we
question.
are incorporating advanced technology.
Is their question?
Yeah, we are incorporating other advanced technologies too, where we do blood investigations, primarily HIV or some sexual disorders. Primarily, it goes with the interrogation. Prashna pariksha has to be done.
Yes.
Unless until Prashna pariksha will not get to know the effect or what that patient has affected or not, will not be.
Yes, next question.
In Unmad,
Last. Give chance to others.
As per your second pratigna, you are denying Karana to be one among Dashavidha parikshas. So, in my opinion, they have clearly mentioned Karana as the Karta or the Hetu of the Dashavidha pariksha. So, he is the initiator. So, in my opinion, without Karana, no parikshas can be done. So, we are
Yes, if pariksha is not there, how the pariksha is?
so we are hypothesizing, we are making a pratigna that he should be, or the Karana is the one among the Dashavidha
As
pariksha.
per your opinion, the role of the physician is 0 here. In the Athura Pariksha. Yeah, you are denying.
Sir, according to your second pratigna.
Then who is going to examine? Attender?
As per the second half of the title, only Dashavidha pariksha is to be examined in patient. Dashavidha parikshas include Prakruti, Vikruti, Sarasamanana, those points. Na?
Yes.
Karana is Vaidya. He itself examined the.
Yeah, then you are shifting towards Dashavidha. There.
According to your second pratigna.
Yeah, we want to clear that the pariksha.
When students are there, then only we consider as teacher.
Yes.
When patients are there, then only we consider as doctor.
Yeah.
Relative measures. Isn't it?
Yes.
Okay.
But Bishop is not a bhava in the patient, which has to be examined.
Yes. This is
They
the
have given
answer.
there is a karana, but he is not a bhava in the patient to be get examined.
But they are considered as a Dashavidha pariksha bhavas. So they are the tools of examination. So we need Karana as one among them. So without them, the pariksha is not initiated.
All the
may it be Panchanidanas, sorry, Nidana Panchakas or Shadkriya.
Simply without
so Karana is
Karya won't happen.
It doesn't happen, sir. But we are telling that he is not a factor in the patient.
Yeah, physician is not a point of
In the patient.
in the patient. He is
He's
outside,
the patient.
Okay.
So it
Done.
can be taken as a Athara pariksha.
Done with these points. Okay. Now Pratishtapana will have questions from Sthapna. Sthapna against Pratishtapana. Please proceed with your questions.
Okay, my first question is, you have told so much about globalization, instruments, Atyayika Chikitsa, so much you have told. All those instruments, Atyayika Chikitsa, whatever we use, everything comes under Karana. They have stated that medicines, instruments, whatever you're using comes under Karana. How will you justify that? You have given a total pratikya on that. That all globalization instruments, they are not in Dashavidha Pariksha Bhava. How will you justify?
Point is very important. You also want to take help of some investigations as research protocol, etc. But how deny the Karana in understanding the disease diagnosis?
First stand is that we are not denying the Dashavidha Pariksha. And the second stand is that
Then
we are
accept
telling
it.
that Dashavidha Pariksha is only not sufficient. Your topic stands by it, so we are telling. We are telling other parikshas are also important. Is sphygmomanometer is mentioned in Ayurveda. I am not telling anything apart from the science, but I am telling it is mentioned. It is an invention of the scientific technology. We can take a use of it.
Can
See-
take it.
see.
Can be included in Karana Pariksha. We can use it. We are not saying we cannot use the things.
No, no. Are you shifting towards other tantras,
That's why we
utilization,
are telling we have to
or
take
not?
the science, other technology to be blended with Ayurveda. That's what we are saying. We are not telling that your Karana is wrong. We are not using Karana in Pariksha.
आप नाड़ी करीब परीक्षा करने वाले क्या बीपी चेक करने वाले दोनों नहीं करने वाले आपके हिसाब से?
Whatever we are taking, it is coming under Karana only. That is only included in Dashavidha Pariksha. That only we are stating.
Whichever you tell, it falls under Dashavidha. They have a big circle there. Okay,
If
everything
that's
falls.
the standard, then you don't. I want to ask you one question. Like you are saying about globalization and all. Like globalization in today's modern era practice, how they are doing examination, like based upon the inspection, palpation, Parkinson, and auscultation. You have stated so many parikshas. We are saying like one Dashavidha pariksha can include all of them. What will be your standard pariksha that you will say for standardization that this one pariksha should be done? Then this is the standard pariksha for Ayurvedic examination.
As the book, like Acharya, after
Question is very apt, and be very careful in answering. Which is the ideal methodology of examination? If you don't agree with the Dashavidha Pariksha Vishesha Bhavas of Charaka, then what is next else to be examined in patient?
So there are different contexts again, as we have mentioned clearly. Though we are not, already the Acharya has said, Bahuvidham Pariksham, Tatha Pariksha Vidhivedaha. There are many kinds of, before telling Dashavidha Pariksha Bhavas only, they stated the many kinds of parikshas, and even the tools used for the pariksha is also different based upon the pariksha vastu, that is the rogi. So when it's already stated there are many kind of rogas, and again there is nothing like Charaka has quoted, this is the standard protocol treatment. There's always room for many options, and the basic idea of Ayurveda treatment is Purusham Vikshya. So it's not only for treatment, you can apply that for examination also. So when it comes to the modern evidence-based research also, why we are behind evidence-based research, why we are into so much of research and RCT is because they have stated that Ayurvedic research protocol is a black box design. We know the input, we know the output, but what happens in between is always a query. So that is why globalization is required. Again, as we already told, core principles are always respected. But updating ourselves, as today we have upgradations when it comes to Samvada.
Yes, yes.
Like that, we also should upgrade.
Yes. Purusham Viksham. As per the requirement of the patient and need for the patient, should use examination methodology and answer from Pratishtha. The next question.
We have one quotation like Dashavidham tu pariksham karanani yaduktam agre tat iha vishak adi samsaryam sandarshishyam. What you explain regarding this quotation? So what it means? So they have mentioned it like yaduktam agre. So what the word implies?
Agriya is the most important word what is used by Charakacharya here.
Agre means it's not the prime one, because if it was Agre, Sushruta and other Samhitas would have also mentioned the same. They have modified the examination manner. As I quoted it in Sushruta Samhita, while examining the Atura, he has stated, like I'll be telling that I'll give you a point. He has stated that Ayu, Vadi, Rutu, Agni, Vaya, Desha, Bala, Sarpa, etc. factors. 12 factors has to be examined. Then Ashtanga Hridaya, he has also mentioned 12 factors which has to be examined in the patient. Okay, this has to be taken as in a consideration that if it is mentioned in Agra for Charaka, it is not important that Shushruta also has to accept. In the same way, we is not, it depends on the Bishak or someone or a Purusham Vikya, the acceptance of that is not prime one. We are telling it is a main, but it's not the only one.
Which one can become the only one?
It is, no one has mentioned that it's the only one. We are not saying that it's the only one.
Okay.
And I wanted to quote that in Evam. The meaning of Evam is that it is mentioned that Evam means we should see in the all directions. Okay? We have to see in all directions. So it might be other samhitas also and other sciences also. Only denying on Charaka Samhitas is not a
Means
No, we are not depending on the only
as
Charaka.
as per their statement, even the Agni-Vishya Tantra also support the scope of other Tantra is the answer. Okay, next question. Next question.
So again, you have mentioned like an Ashtasthana pariksha. In that Nadi pariksha also you have mentioned. So in whole Charaka or Sushruta, if you are going to consider, so in how many parts they are going to be used in pariksha aspect? So Nadi pariksha, whether it has been mentioned or in any of the conditions, so they have mentioned the Nadi pariksha.
Yogaratnakara and Charangadhar also has mentioned that. It's not like if Charaka is not mentioned, if Shushruta is not mentioned,
No, I'm asking why they have not mentioned. Is there any rationality behind that? Is there any importance they have not mentioned means? So it's having any importance or what?
Evaluation. After authors would have found significance in finding Nadi. They have Nadi Shastra. So they would have found some significance in examining. If not, why Yogaratnakara would have mentioned diseases by understanding Nadi? Why Sharangadhara has mentioned separate chapter for Nadi Pariksha, where he assessed doshas, Ayu, everything from the Nadi. It might be the importance.
Again, the thing, if you are going to take it as a IU examination through the help of Nadi Pariksha, again, it comes under the IU examination in the Anubandha Pariksha. So again, it can form. So however, you are going to examine the things, whatever we are doing by the means of Dashavidha Pariksha only. So we can achieve the things with the help of this also. And whatever you have been mentioned, that can be also taken it under the consideration of Dashavidha Pariksha.
That is what the last Pratigna was concluded. Kalam Parinama Uchyate. Where Nadi Pariksha doesn't only tell about the Ayu, it tells about the disease condition also. So what is the type of Nadi when the person is Shudita, when he has in Jwara and many other conditions. So if it is so as considered that everything comes in Dashavidha Pariksha, again we can consider everything in other Parikshas also and we can accept it at the same time.
Yes. Next. Okay. Now, any queries from Sthapana and Pratisthapana against Vitantavadins? Last chance.
Again, you have mentioned regarding.
No, you are. Oh, okay. Now, Sthapana, Pratisthapana member will ask the question again, Vitantavada, if any doubts against Vitantavadins. Go to Pratisthapana. प्रतिष्ठापना स्थापना आपके क्वेश्चंस कुछ है वितंडवादी के लिए?
You are not agreeing to Dashavidha Pariksha and others. So what is your ideal method to whom you are following?
What is your opinion? Where you stand? There you stand or here? Or where?
We are to establish any statement. We are just against him.
Yeah, still against. Okay.
Still want the answer? We go with the Pratisthapana.
Okay. Now, query round, that is Jignasa round, which is one of the important Vadamarga mentioned in 44 terms which are there in the Vimanasthana. Now, Sabhaya Krate Avasaraha, that is queries by audience. If any queries are there, please raise up and you might. Audience. Any audience can raise your hand and ask the question. I think all audience are satisfied with the debate. Any queries? Okay, I think now we want to take the opinions from the different principals present virtually. Respected Dr. Radhakrishna sir is online, joined online virtually, and I request Dr. Radhakrishna Sarji to give his valuable opinion on this today's debaters debate. Over to Radhakrishna Sarji.
Okay, thank you, sir. Thank you.
Yes, sir. Please proceed.
Principal Dr. Suhas Shetty ji and all organizers. Samvada 8 National Level Intercollegiate Scientific Debate is an innovative concept wherein discussions should be taken place between the scholars. In olden days, many methodology and tools were established for various things. One of that is Tatvishya Sambhasha, wherein method in a scientific and systematic manner. These methodologies are there in the Charaka Samhita, and rishis have given the protocol as per the scientific proforma. These scientific tools were only in books and for the purpose of examination. The practicality of these books are not tested by other scholars. Samvada is one of such practically tested wherein methodologies are practiced in a platform. I congratulate IIT's Mahavidyalaya for making the dream of a practical Charaka Samhita a reality. It is really helping students. I thank Dr. Suhas for bringing the ancient wisdom of Ayurveda to the students and giving practical. I think definitely it will help the society and they will be benefited by this Samvada program. Finally, I congratulate Stapana, Pratistapana and Vitandavada teams, and my thanks to Dr. Kiran, expert and principal Ravi Patil Ayurveda Medical College, Belgaum, and all the organizers who organized this wonderful program. Thank you.
We have requested Dr. Belavadi sir, Principal DGM Gadag Ayurveda Medical College. Meanwhile, if he joins, we'll take his opinion later. So we'll move on to take the opinions of different mentors present in this assembled hall. I would like to call upon Dr. Savita Mane Madam for her valuable opinion on today's debaters team. Mentor of GAMC, please big round of applause for Dr. Savita Mane Madam for her opinion.
Good evening to all. So this was very wonderful session organized by Samhita Department of KLA Ayurveda College, Belgaum. I would congratulate all the participants and the PG scholars for their wonderful knowledge sharing and the discussion. So As our principal sir has said, this was made into true what was said in our Acharya Charaka, like how Vada used to happen. So this is the live example, so we can see. So I want to congratulate again. And as Acharya Shishruta has said, Satata Adhyanam Vadaha Paratantrava Tad Vidyat Acharya Sevacha Buddhi Medha Karo Punaha. So you have lively experienced the Nidhi Rasayana by seeing the Vada of these PG scholars. Thank you one and all. Thank you, sir.
Thank you, ma'am, for your inputs and wishes. Now I would like to call upon Dr. Sumaya Madam, mentor, DGM Ayurveda Medical College, Gajar. Give a big round of applause to Dr. Sumaya Madam, mentor, DGM Ayurveda Medical College, Gajar.
Respected President, sir, Dr. Shilpa Shetty, Dr. Kiran, sir, and Dr. Prabhakar, sir, heartfelt thanks for inviting us for this wonderful session. Acharya Charaka says Bishop Vishesha Sambhashe, where Sagrahya Sambrasha, Vigrahya Sambrasha, Tarka, Vitarka, all are very much explained in Manasthana, and that itself acts as rasayana in our body. And Dashavidha pariksha gives personalized assessment of a patient and also a healthy person in terms of curative and prognostic and preventive aspects. And this program has given us a well thorough knowledge in terms of all these things. And I'm very much thankful to all the organizers for inviting us. Thank you so much.
Thank you, ma'am. It's our immense pleasure to have Dr. Santoshi and Belvadi, Principal, JSBV, DGM Ayurvedic Medical College, Gadak. Sir, please share your opinion, sir. We'd like to have your opinion.
Yes. Good evening, everybody.
Yes,
Respected Sir Shetty, sir, organizing member of National Level Scientific Debate Samvada, organized by Kelly's BMK Ayurveda Medical College, Belagavi, teaching faculty, dear scholars, warm wishes to each and everyone. First of all, I would like to congratulate Dr. Shetty, sir, the principal and medical director, as well as the team member of organizing team, national level scientific debate, Samvada 8. The topic of Samvada is on Dashavidha pariksha under the heading of Stapana, Pratistapana, Vitandavada, particularly on the topic Dashavidha pariksha. The pariksha Yathartha Jnana and specifically explained by Acharya Charaka in Vimanasthana under Dashavidha Pariksha heading. As we know all, Pariksha Karano hi Kushalo Bhavantu. The intelligent physician, first he will thoroughly examine, then he would like to plan the appropriate treatment. So our acharyas have told different examination methods by different acharyas. Among the Dashavidha Pariksha is one. Acharya Charaka clearly stated that what is the purpose of this Dashavidha Pariksha? Understand or to assess Rogibala, Rogabala and Ayurbala Pramana Jnana Heturva. So here the strength of the patient, the strength of the disease as well as lifespan of the patient. So by understanding these, we can plan, or a physician can plan the successive management. So with that, it is very difficult to plan. I'll take one example. For example, the understanding of Vaya is very important because the acharyas have classified Vaya as Balya, Tarunyata and Ruddhapya. The understanding of the Balya Avastha, the age criteria, the specific disorders under this heading, and what are the treatment dosages, what are the different size and instrumentations when we are practicing Panchakarma in the childhood, Even in Tarunyata, the strength of an individual or the immunity power, and in the Ruddhapya as the Kshaya of the Bala as well as Kshaya of the immunity. So these will help to plan the type of treatment modalities, the quantum of the medicine to be used, and how much we should take care of this. Even the acharyas have mentioned these Dashavidha pariksha. In the different contexts, our acharyas have given clues that yukta pekshi bishak puryat. So without violating the principles of Ayurveda, our acharya has told whenever the patient comes to you, at that juncture, what type of treatment is needed, the intellectual physician should plan the treatment and advocate. That is explained by the acharyas. Even one more quotation in Charaka Siddhisthana, Samikshehi Doshaushada Desha Balakala, like that. For the Chakrapani commentary, as Samikshehi Jnanapurvaka Vaidya. Once again, the intellectual physician should analyze dosha, dusha, ama, agni, rogabala, and rogibala. So based on this, the physician should plan this treatment. So under the heading of Stapana, Pratistapana, and within the Vada, different teachers and different PG scholars has tried their level best. And what I observed, our teacher and our PG scholars, they have worked a lot. In the similar way, the government Ayurveda Medical College, Mysuru, they are also tried their level best. And I am sure that with such debate context, they have read all the Samhita Grantha related to Dashavidha Pariksha and updated knowledge. So see, routinely what happens in our clinical examinations, if we analyze the patients under Dashavidha Pariksha heading, the student or the scholar used to tell Pravara Madhyama Avara. Pravara Madhyama Avara, beyond that they won't tell anything. But at this juncture, with the scientific evidences of these debates on Dashavidha Pariksha, by analyzing all these, our PG scholars and teachers, they become thorough under the analysis of these Dashavidha Pariksha under the heading of Stapana, Pratistapana, and Vitandavada. So with these few words, I take this opportunity to congratulate and thank for giving an opportunity to DGM Ayurveda Medical College and Hospital PG PhD studies for giving this opportunity, and they have invited our teacher, Dr. Sumaya, and all our PG scholars, and they worked hard and planned to context in the heading of Vitandavada, as well as from the team of Government Ayurveda Medical College, Mysuru, which is one of my mother institution. I take this opportunity to thank and wish Dr. Radhakrishna Rao, principal of this esteemed institution, JMC Mysore, and the team of BMK Ayurveda Medical College, Belagavi, for their homework. What happens usually, we organize seminar, the student or the teacher or the scholar will stand on the platform and present their PPT under the heading of 4+1 minute or 5+1 minute, it is one way. But whatever the team taken strain to organize this debatable environment, this is very encouraging, and we must all congratulate the team of Kahir, BMK Ayurveda Medical College, Belagavi. This is one of the innovative informations, and everybody should feel happy and pleasure that it is a new approach and a new experience for each and every scholar and also for young teachers. So since morning, all are engaged in interacting with Dashavidha Pariksha under 3 heading, and definitely this will be helped a lot to all the spectators, delegates, the PG scholars and the teachers, and fruitful organizations. Once again, I congratulate whole team as well as the team leader, Dr. Swashetty sir, and once again wishing you grand success for all the team to this event. Over to you, sir. Thank you very much. Thank you.
So much. Now, another one mentor's opinion has left to take. Big round of applause for Dr. Chaitra ma'am, mentor for Sthapna, PLE BMK Ayurveda Mahavidyalaya. Over to you, ma'am.
Good afternoon, everybody. I take this opportunity to thank the college and the department for giving me this opportunity to mentor the Sthapana group today. One striking feature of today's debate was both Sthapana and Pratistapana use the same set of references. we use the same set of reference saying that everything comes under Dashavidha Pariksha Bhava. They use the same set of reference to say that no, there are other Pariksha Bhavas apart from your Dashavidha Pariksha Bhavas. So that was one striking feature. Same set of quotations were quoted by both the things. And that was a good session. I thank everybody for helping us, and special mention to Dr. Asta and Dr. Shivani, who had helped us throughout in organizing their stay and to accommodate them throughout the session. Thank you. Thank you.
Thank you so much, ma'am. Now, it's our immense pleasure to invite on behalf of the Department of Basic Principle as well as KLE BMK Ayurveda Mahavidyalaya. I would like to request today's expert, Dr. Kiran Khoth sir ji, for his valuable remark on today's debaters' debate.
Namaste to all. Rubhyo Namaha. Respected dignitaries on the dais, off the dais, as well as online dignitaries also. At this juncture, I would like to thank Suhas Kumar Shetty sir and the entire team of Samvada giving me an opportunity to participate in this Samvada. And I am recalling, on this occasion, I am recalling my PG days of debating. And I always feel homely when BM Kankanwadi College conducts any of the events and invites us to participate and giving an opportunity to present our views on any occasion. And I request sir and the entire team, sir, please keep on calling us as an audience also, or any kind of the event. Other than this expert key opinion, I feel that many of my friends are here. We meet them, we greet them. It is always homely environment at BM Kankanwadi College. Coming to the topic proper, I am directly going to the advantages of Dashavidha Pariksha as an assessment of Roga and Rogibala, as everyone knows, comprehensive patient examination. It's a tool for clinical research, and as well as we can plan treatment planning, association with lifespan and health. And as I told, it serves as a clinical tool in research also. These are the advantages of Dashavidha Pariksha. And while we know that whenever there is a topic, we will be having advantages and disadvantages according to the usage and the situation. So the disadvantages of Dashavidha Pariksha, as far as my knowledge, it is a subjective interpretation. And there is a lack of standardization in Dashavidha Pariksha, and it is time consuming, as we all know, limited scope. And as the Pratishthapana group told that not suitable for emergency many times, and limited applicability. Like Dashavidha Pariksha might not be applicable in cases where the patients are unable to communicate effectively or have severe mental or physical impairments, for example. Despite these limitations, Dashavidha Pariksha remains a valuable diagnostic tool in Ayurvedic medicine, offering a comprehensive understanding of patients' physical and mental state. In conclusion, Dashavidha Pariksha is a fundamental concept in Ayurvedic medicine that offers a comprehensive approach to understanding a patient's physical and mental state. By examining 10 essential factors, healthcare practitioners can gain valuable insights into a patient's overall health and develop effective treatment strategies. While Dashavidha Pariksha has its own limitations, its importance in Ayurvedic diagnosis and treatment cannot be overstated. As we continue to explore the intricacies of this ancient medical system, we may uncover new ways to integrate Dashavidha Pariksha into modern healthcare practices, ultimately enhancing patients' care and well-being. Thank you for exploring this topic with me, and I congratulate all the three groups for actively participating and presenting their views on Dashavidha Pariksha. Once again, I thank you all the organizing committee and Suhas Kumar Shetty sir. Thank you.
Thank you, sir. Thank you so much for your enlightening words and accepting our invitation to participate as today's subject expert for analyzing debaters debate. Thank you so much, sir. And moving to the next event, I would like to request our beloved principal, respected Suhas Kumar Shetty sir, to give his presidential speech.
A very good evening to all of you. Warm greetings for all of you from KLE Academy of Higher Education Research and KLE Shri B.M. Kankanwadi Ayurveda Mahavidyalaya, Belagavi. On behalf of the institution, we would like to thank all the three participating team, their principals, their mentors, and especially the best part of this debate is there are never a winner or a loser in our debate. All 15 students are winners. And this is the best part of the program that we do not say, because each and every individual has a different perspective of looking at a problem and how they approach towards that. And that's the whole intention by this particular event. It was a dream event, which was then conducted by the former principal and the present president of Board of Ayurveda, Dr. Srinivas Prasad, and the Department of Samhita and Siddhanta came forward this unique program. As we all know that now it's more towards learning with fun or learning with practice, generating all the confidence in the scholars to inculcate that clinical skills. So that's the reason why a lot of things that we try to learn theoretically is to be practiced. And one such innovative practices that we have in our institution is the introduction of Samvada. And we always conduct this program even in our college also every month. There will be interclass or interdepartmental or inter students debate happenings every month in the institution also. And once in 3-4 months, we try to conduct this in between various institutions. We always try to see which are the institutions that we should invite. We always go with a policy that whoever we try to have a new MOU or new member of understanding or new collaborations that we develop. We generally try to invite such. And the two recent collaborations that we have is with these two institutions. And that's where we have invited these two institutions. And this will be a continuous process that will always be happening. And not only this, there are so many newer programs that we are trying to imbibe. The ultimate aim is to create a very good academic ecosystem where the students can really foster their learning process, and also with the newer technology and the innovation that always adds to the flavor of learning. So on behalf of the institution, I take this privilege to heartily thank Dr. Hitesh Vyas, the keynote speaker of today's program, the professor from the Department of Samhita and Siddhanta from ITRA Jamnagar. We also would like to thank the principal of both the institution, Dr. Radhakrishna sir, as well as Belwadi sir, for taking time to be present throughout this entire debate competitions. Thank you very much, sir, to both of you. And very importantly, I would like to thank Dr. Kiran Khoth, the principal of Ravi Patil Ayurvedic Medical College, for accepting our invitation and being a part of this program as a subject expert. And we are really happy and honored with your presence, sir. Thank you very much. My appreciations goes for all the three mentors who have taken keen interest in preparing the students, which is evident by the quality of the discussion that we had in today's discussion. And it was really good to know the different way of debating. I think we all should definitely go into the further depth of the grounded information that we have in the Charaka Vimanasthana 8th chapter. And this is a very useful chapter that we have for all the students. Like how do you examine? How do you accept a teacher? How do you how do you learn how to test a book? And how do you conduct different types of interaction? What are things that you should do? And because they all develop your soft skills. They all develop your communication skills. And this is where probably, and that's as rightly mentioned by Radhakrishnan said that many times we use this as just a theoretical learning. But when you start practicing different types of, we have different types of sambhasha, like Vigriya sambhasha, Sandhya sambhasha, Jalpa, Vittanda. There are Tantra Ektis, Tantra Doshas, Vada, Siddhantas. So all these are very, very apt concepts, principles which need to be adopted. And as the institution has three main principles like tradition, technology, and innovations. So all these concepts should evolve in the days to come and benefit ultimately the society and the people at large. And that's the whole purpose why as medical fraternity, we should try to imbibe the concepts and try to apply it at a larger scenario. Coming to the topic, I think a lot of have been already been debated and the expert opinion has been always been given. As we know, we always say that we need to examine the patient and then probably plan the treatment, as it's mentioned in Charaka Sutra 20th chapter, 20th sloka, Rogam Ado Pariksheta, Tato Anantram Aushadam. Like we will first examine the patient and then probably plan the line of treatment that is appropriate for the patient. And that is where there are different type of parikshas, both for Roga Pariksha as well as Rogi Pariksha. But ultimately, it is the physician, it's a Vaidya who should really imbibe all this, like Daksha, Tirtha, Shastra, Drishta Karma, Suchir Bishak. So these are the qualities that the physician should have to see that, and it is mentioned in Vimanasana also, like Aturasya Antratmani. You should go into the depth of the patient and try to evaluate. Because sometimes what happens, the patient comes with the problem, but sometimes we have to be very, intrusive to understand the patient's condition and then probably come to a conclusion. So whatever could be there, but it is ultimately for the Roga and Rogi Pariksha. And very importantly, the Dosha Bala. Dosha Bala, Roga Bala, Rogi Bala is the ultimate parameter that we try to assess and then probably try to come to a conclusion whether you should go with Nityopasha Chikitsa, Daivapasha Chikitsa, or Sattvaja Chikitsa. And that's the ultimate objective why you conduct different types of examination methodology in Ayurveda. So once again, I would like to compliment all the 15 participants, their mentors, their principals for joining us in this great celebration of learning process. And I really appreciate all the faculties of the Department of Samhita and Siddhanta, Dr. Prabhakar, Dr. Prashant, Dr. Praveen, Dr. Chaitra, and Dr. Savita, who have taken keen interest in organizing this particular program. And special thanks to all our dear students who have been patient here and also learning this particular whole process of how the Samvada goes. And we're very happy that more than 1,100 delegates have joined online who have joined from different parts. There are also different inquiries like a few message from a few of my Russian patients also to send the links. So there also been few of the global participants also for this particular event. And we are definitely going to make this, maybe we were just planning to have the international version of this particular program by inviting either the college from Nepal or Sri Lanka in the upcoming days to come. Probably, maybe because I'm traveling to Sri Lanka next week or next month. Probably I'll try to invite There are 3 colleges in Sri Lanka. Probably I'll try to invite one college. If all they can physically come here, that's good. Otherwise, we can definitely, our students can go to Sri Lanka and we can have the program there. There are a lot of opportunities. There are a lot of opportunities for learning. So make the best use of these opportunities. And once again, wishing this program a very nice success. And we'll come with a bigger, better version of 9th version of Samvada. Thank you.
संवादस्य महत्त्वम् एवं दशविधपरीक्षायाः विषये उद्बोध्य अस्मान् अनुगृहीतवद्भ्यः प्राचार्येभ्यः धन्यवादाः। सम्प्रति अद्यतनकार्यक्रमस्य उपान्तिमस्तरे वयं स्मः प्रमाणपत्रवितरणं। तदर्थं प्राचार्यान् प्रार्थयामि सर्वेभ्यः प्रमाणपत्रं वितरन्तु इति। तत्रादौ अद्यतनसंवादकार्यक्रमे अस्माकम् आह्वानं मुररीकृत्य आगतवद्भ्यः डॉक्टर किरण एम खोत वर्येभ्यः प्रमाणपत्रं वितरन्तु इति प्राचार्यान् प्रार्थयामि। प्रतिष्ठापना समूहस्य मार्गदर्शिका आसन् डॉक्टर सविता के मान्यवर्याः। ताभ्यः प्रमाणपत्रं वितरन्तु इति प्रार्थयामि। वितण्डवाद समूहस्य मार्गदर्शिकाः आसन् डॉक्टर सुमैया एम.ए. वर्याः। ताभ्यः प्रमाणपत्रं वितरन्तु इति प्रार्थयामि। स्थापना समूहस्य मार्गदर्शिकाः आसन् डॉक्टर चैत्रा वर्याः। सम्प्रति संवादकार्यक्रमे स्थापना सदस्यानां कृते प्रमाणपत्रवितरणं क्रमशः आगत्य प्रमाणपत्रं स्वीकरोतु इति प्रार्थयामि। मैसूरुतः समागताः प्रतिष्ठापना समूह सदस्याः। वितण्डवाद समूहस्य सदस्यानां कृते प्रमाणपत्रवितरणं। अद्यतनसंवादकार्यक्रमस्य नियन्त्रकाः आसन् डाक्टर् प्रभाकर बी हेगडे वर्याः तेभ्यः प्रमाणपत्रवितरणम्। संवादकार्यक्रमे नितरां सहकुर्वन्ति अस्माकं विभागस्य प्राध्यापकाः डाक्टर् प्रवीण एन् भिरेडे वर्याः तेभ्यः प्रमाणपत्रवितरणम्। सम्प्रति निरूपकस्य कृते प्रमाणपत्रवितरणम्। प्रमाणपत्रं वितरितवद्भ्यः अस्माकं विभागस्य विद्यालयस्य प्राचार्येभ्यः धन्यवादाः। सम्प्रति एकं समूहचित्रग्रहणं स्वीकुर्मः। सर्वेपि प्रतिष्ठापना स्थापना वितण्डवादी सदस्याः एवं मार्गदर्शकाः विषयविशेषज्ञाः अपि सम्मिलिताः भवन्तु इति प्रार्थयामि। एवम् अस्माकं संवादकार्यक्रमः अत्रैव समाप्तिमेति। संवादकार्यक्रमे धन्यवादावष्कृतिः अन्तिमः कार्यक्रमः भवति। अत्र केली संस्थायाः कुलपतिभ्यः कुलाध्यक्षेभ्यः अन्येभ्यः पदाधिकारिभ्यः अस्माकं महाविद्यालयपक्षतः अस्माकं विभागपक्षतः हार्दं धन्यवादाः। एवमेव अद्यतनसंवादकार्यक्रमे औपचारिककथनं कथितवद्भ्यः डाक्टर् हितेश व्यासवर्येभ्यः अस्माकं महाविद्यालयपक्षतः हार्दः धन्यवादाः। एवमेव अस्माकम् आह्वानमुररीकृत्य विषयविशेषज्ञाः आसन् डाक्टर् किरण् खोत्वर्याः तेभ्यः अस्माकं महाविद्यालयपक्षतः हार्दः धन्यवादाः। एवमेव संवादकार्यक्रमस्य सञ्चालने नितराम् अस्माकं प्रोत्साहयन्ति अस्माकं महाविद्यालयस्य प्राचार्याः डाक्टर् सुहास् कुमार शेट्टिवर्याः तेभ्यः अस्माकं विभागपक्षतः हार्दाः धन्यवादाः। एवमेव अत्र स्थापना प्रतिष्ठापना वितण्डवादसदस्याः नाना विद्यालयतः समागताः तान् अत्र प्रेषितवद्भ्यः डाक्टर् के.एस्. राधाकृष्णरामराव प्राचार्याः सर्वकारीय आयुर्वेद महाविद्यालयः मैसूर तेभ्यः एवं संतोष बेलवाडी महोदयाः JSSVBS श्री DGM आयुर्वेद महाविद्यालयस्य प्राचार्याः तेभ्यः अस्माकं महाविद्यालयपक्षतः हार्दाः धन्यवादाः। एवमेव सर्वेभ्यः समूहेभ्यः मार्गदर्शनं कृतवत्यः डाक्टर् सविता के मानेवर्याः डाक्टर् सुमया MA वर्याः एवं डाक्टर् चैत्रावर्याः ताभ्यः सर्वाभ्यः अपि महाविद्यालयपक्षतः धन्यवादाः। एवमेव मञ्चसञ्चालने वेदिकायाः निर्माणे सर्वेपि अत्र कर्मचारिणः सहायं कृतवन्तः। KLE कर्मचारिणः एवं अस्माकं महाविद्यालयस्य कर्मचारिणः हरीश एवं अरुण ईरण् एवं सर्वेपि अत्र सहायं कृतवन्तः। एवं अस्माकं स्नातकोत्तरविभागस्य छात्राः डाक्टर् शिवानी एवं डाक्टर् आस्था ताभ्यः अपि अस्माकं विभागपक्षतः वेदिकायाः निर्माणे सर्वेपि अत्र एवं अत्र संवादकार्यक्रमः समाप्तिमेति। अग्रिमसंवादे पुनः वयं सर्वेपि मिलामः। अत्र संवादकार्यक्रमः शान्तिमन्त्रेण समाप्तिमेति। सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखमाप्नुयात्। ॐ शान्तिः शान्तिः शान्तिः।